Thank you. Is that all for group 1? Okay, group 2. Group 2.
Good morning. Good morning, sir. Good morning, everybody. My name is Kingsley Igbinoba. I'm a member of Group 2.
Thank you. Group 2. We just have one group 2 member. Okay. Group 3. If you're a member of group 3, please let's kindly unmute yourself and introduce yourself. Group 3, I hope you can hear me clearly. Okay. Group 3, nobody is present. Group 4.
Good morning, everyone.
Good morning. Good morning, sir. Audi Matthew Philos, Group 4.
Okay, Group 4, continue.
Good morning. Benga Rokoto, member of Group 4.
Thank you.
Good morning. Olushola Olajide Ololade, a member of Group 4.
Okay. Group 4. Is that all for Group 4? All right, Group 5. Please unmute yourself and introduce yourself.
Good morning,
Good
sir.
morning.
Good morning, sir.
Good morning.
My name is Alale. My name is Alale Olamide, member of Group 5.
Okay.
Hello, sir.
Yes, sir.
Yes.
Alale Olamide, member of Group 5, sir.
Okay.
My name is Naomi of Group 4.
Good morning, sir.
Hello,
My name
good
is.
morning. Hello, good morning.
Yes.
Good morning. My name is Alexander Grace, Group 2.
Good morning. My name is Adero Dupo David from Group 5.
Group 5, continue.
Yes, sir.
Okay, Group 6.
My name is
Group 6.
Good morning, sir. Good morning, sir. My name is Anonese Doris Idoma, Group 6.
Thank you, Group.
Good morning,
Continue.
sir. Good
Yeah.
morning, sir. My name is Najoye, Group 5.
You are in Group 6, please. Group 6.
Good morning. My name is Mrs. Udejinta Nora Osinachi, Group 6. Thank you.
Group 6, continue.
Good morning. Good morning, sir. My name is Oluwale Modisoluwa, Group 6, sir. A member of Group 6.
All right. Thank you very much.
Sir.
Good morning.
My name is Ifondi Sugar, Group 5.
Thank you very much. All right. Thank you very much for that introduction. But here is a quick one, please. You notice a member of your group is not present, please try to reach out to that member. Because if a member of your group is absent, it will affect your grade. It will affect your points. It will not just affect the person that is absent, it will affect, please. Although we have exception because some persons had to reach out to.
Sorry to interrupt, sir. Good morning, sir. Good morning, sir. My name is Wambuzo Ufoma Peace, a member of Group 5. Thank you, sir.
Thank you. So, like I was saying, try to reach out to a member of your group that is not present so that the person will be present Because before you're given opportunity to start presenting your...
Good morning, sir. Good morning, sir. Good morning, sir. My name is Alexander Grace, Group 2.
Before you're given opportunity to present, we will take attendance for your group. Okay? All right, let's now say for those of some of our reviewers that are here, I can see Dr. Adik. Please, Alexander, kindly mute the mic. Thank you. I can Dr. Adekalu present. Please, sir. Us.
Yes, please. Good morning, everyone. My name is Dr. Samuel Adekalu. I'm one of the reviewers. I wish you all the best.
Thank you very much, sir. We appreciate your presence and we look forward to learning from your wealth of experience.
This data is open.
Okay, I can see Dr. Loretta. Please, kindly unmute and speak to us, ma'am.
Good everyone. I'm Dr. Mrs. Loretta Onyekwere, talking from Port Harcourt, River State University. And then I'm the reviewer for Group 1.
Thank you very much, ma'am. Happy to have you.
It's my pleasure.
Thank you, ma'am. All right. I don't know if Dr. Kemi Otun is here. Please, if you're here, kindly speak to us.
I don't understand this thing. I don't unmute her.
Okay. While we await the presence of Dr. Kemi Otun, I don't know if Dr. Vivian Alofe is here. Okay. We also await her presence and that of Dr. Adejumo Adegboyega. However, my name is social worker Mbina Ita, and I will be standing in for Dr. Atere in reviewing the seminar presentation of Group 4. Without wasting much time, we will now call on Group 1 member to make themselves available as they present their topic. Now let's do a roll call. Please listen attentively as I call your name. Amalize Rosemary. Please unmute yourself and respond, please. Amalize Rosemary. Okay.
Present, sir.
Okay. Fashola Bokola. Fashola D. Bokola, absent. Ekpoloki. Ekpoloki. Absent.
Good morning, everyone. Good morning, our facility. So, Rosemary Amalinze. Thank you.
Okay. What about Fashola D. Abokola? What about Ekpoloki? Okay. Jacob.
Good morning. Good morning.
Good morning.
Good morning, please. Group 2, Alexander Grace.
Please, I'm calling Group 1 member. Please, let's be organized here, okay? I'm calling Group 1 member. Taking attendance for Group 1 member. Listen to your name, okay? Jacob Peter. Nwambu Ronald. Adeyemisi Rashidat, Umar Salmanu, Bolanle Akunoye.
Okunye, present, sir.
Okay, so we just have 4 of you that are present, that are on ground here, right?
Helen Clarkson
Okay.
is in group 1, sir. Helen Clarkson is in group 1.
Helen Clarkson is in group 1. Okay.
Hello, sir.
Yes.
Ronald, I'm in group 1 too.
Okay, but I mentioned your name earlier. All right. Your reviewer is on ground. So without wasting much time, let's listen to group 1 presentation. The first speaker should please take the floor. And remember, you would be called randomly to make presentation. So each speaker will be just 5 minutes to speak. Your time starts now.
Good morning, sir. Guneji Kalabosipo, group 6, around, sir.
Group 1, your time starts now.
Sir, who is speaking, sir? Sir, who is speaking on behalf of group?
Lami Sunday.
Good morning. I'm here. Good morning, all. My name is Lami Sunday, a member of Group 1. Good morning to all our facilitators online. Good morning to our reviewer, Dr. Loretta. I'm a member of Group 1, and our topic, our research and our seminar topic says, the role of social workers in healthcare, a study of University of Nigeria Teaching Hospital, Enugu. So let's start. First of all, I want to define who a social worker is. From my own perspective and from what I know, it says a social worker is a trained professional who helps individuals, families, groups, and communities to overcome their challenges and differences. So going forward, we'll go through our introduction, which says social work is a helping profession, like we all know from the definition that we just had, that is being practiced across diverse disciplines, which the healthcare is not an exception. Within the healthcare setting, the social worker is usually referred to as a medical social worker. They often work in hospitals, in mental health facilities, as well as clinics. They also practice in community health agencies, nursing homes, and drug rehabilitation facilities. There is a trained profession that takes care of counseling, emotional, social, and aftercare needs of patients. Like we all know, social work deals with the healthcare and the overall holistic aspects of individuals in the society. Unfortunately, many health professionals in Africa do not recognize the essential roles of that social workers plays or could play in our healthcare system. Where the healthcare professionals are aware of the presence of medical social workers, a combination of the two is often maximized for optimum benefit of health users. The study, which we have now, is aimed to identify the roles of social workers that social workers play in the health, and to also ascertain the various challenges to the roles they play, and to develop the methods to improve health outcome as well as the holistic well-being of individuals in the society. So quickly, we go to the background of the study, which which talks about the social work relationship. It says health profession is as old as the profession itself. Since the beginning of the 20th century, social workers have been involved in the delivery of healthcare services, especially for the elderly and patients with critical health condition. That is how social work came to be came about in the olden days, before the advent of the professional aspect of it. It has always been the care for the elderly and the sick. Then the sick, that is people who are critically ill. So as a profession, social work seeks to help and empower vulnerable groups, including people that are living with chronic diseases, like I said earlier, diseases like HIV/AIDS, and it concerns itself with the welfare of persons. And then it involves it came about because when HIV first came about, because of the stigmatization and the treatment that was being given to people, social workers then tend to give more care, and then decided to look towards those people that are being stigmatized with those diseases, and then tend to render a helping hand to them. And then it was also geared towards the welfare of persons who could not function fully in the society due to health conditions, thereby providing holistic health care, which entails understanding the patient's social, environmental, as well as the prevailing factors contributing to the patient's condition. Social workers utilize the strength-based persons in environment perspective to provide the contextual focus necessary for clients and family-centered. In spite of the fact that social workers plays indispensable roles in healthcare system, they are likely to face unique challenges, which is normal. There is no profession that has no challenges. As well, social work is not an exception. So we are likely, or they are likely to face challenges. Let's say, because we are social workers in the making, we are likely to face challenges in discharging their duties. Many governments do not place priority on social workers, also social workers' role in the healthcare system. And Nigeria is
Yes,
not also an exception.
Please, you have just 1 minute to round up.
Okay, so hence the study of this in order to check. So we'll go down to the statement of the problem. So the healthcare system, many medical doctors and other health professionals do not adequately understand and recognize the role of social work in hospital setting. So hence the reason for these studies. And also, we move quickly to the objective of this study. The objective of this study is to identify the roles of social workers in healthcare system. It is also for us to ascertain the barriers social workers encounter in carrying out their roles in various healthcare centers. To also develop methods for improvement of social work practice in the healthcare. And our research questions will go this way. What are the roles of social workers in healthcare? What barriers do social workers encounter in playing their roles? And then what method can improve social work practice in healthcare? Thank you, sir.
Thank you very much for that nice presentation. While the first speaker from Group 1 was presenting, Dr. Vivian Alofe came in. Please, ma, kindly speak to the House.
Good morning.
Good morning, ma'am.
There is a mic that is unmuted. You can hear distracting noise in the background. If you are not speaking, I will advise that you mute your mic. Maybe the host can do a good job at that. Good morning, everyone.
Good morning, ma'am.
Good morning.
Thank you. The house is quiet now. Thank you. So this is a very good start. I am glad to join in. I'm excited about the number of participants we have. I am looking forward to very sound and insightful discussions here today. So I would like to encourage all the participants, all the presenters, the group members to do their best to educate us. I would like them to see it as an opportunity to bring more knowledge to the table and not see it as an avenue to be criticized or something. All of us are here to take one or two things home from the work you have done. So we are looking forward to learning and exchanging ideas. Thank you so much, everyone. We'll have a good one, I believe.
Thank you immensely, Dr. Vivian Alofe, for those kind words of encouragement. We appreciate that, man. Going forward, we'll now be calling on in the person of Ms. Nandum Amalinze. Please, your time starts.
Okay, please, Mr. Mbina, please, I'm not the second speaker. Mr. Lucky Ebo is the second speaker. I'll be speaking as the third speaker. Thank you.
Sorry. Earlier on, I was going to call randomly. Please.
Mr. Mbina. Hello, Mr. Mbina.
Wow.
What is happening now?
Can I be heard?
Yes, we can hear you now.
Yes, sir. Yes, sir. Mute yourself.
Kindly mute mic. Host, can you help us to mute some of these unmuted mics? Thank you. So I was trying to say something. The instruction earlier was I would mention names randomly. Okay? So please, Nonyelo Mamelise, you're the second speaker.
Okay, good morning, our facilitators and our honorable reviewers and my colleagues. All right, we divided it in parts too for the three speakers, but I'll be taking the part of discussion on findings on the roles of social workers on healthcare, a study of University of Nigeria Teaching Hospital, Enugu. And we got three themes, which are roles and motivation for improvement for better healthcare outcomes. On roles and motivations, in line with global best practices, medical social workers play vital roles in patient care in healthcare settings. Medical social workers are responsible for providing individualized services to patients and their families, such as counseling and assessment services. Participants at the facility we used expressed the necessity of these services for the happening of clients and patients. Then, under challenge is a highly esteemed profession in the majority of Western countries. This may not be the case in Nigeria, where social work is respectively a new field that has recently gained professionalism. Some participants acknowledged that their duties were appreciated by other health team members, such as physicians, nurses, and other health care workers. However, some others felt neglected and unappreciated during the collaboration. Then for the methods for improvement, from research and studies, working as a social worker in Nigeria's health sector is highly challenging. Their services are underestimated by other health professionals, even the government. However, there could be room. Then in concluding, the medical social workers at the University of Nigeria Teaching Hospital, the findings revealed that social workers played vital roles in patient care, including assessment, counseling, and fundraising for indigent patients. However, they face challenges as lack of appreciation and recognition from other healthcare professionals, discrimination and neglect, inadequate facilities and resources, shortage of qualified and certified social workers, and political bureaucracies. To this end, the government should create policies establishing work boundaries for professionals in healthcare and good working conditions too. Recommendations. The study recommends that in the management of social determinants of health, healthcare and hospital management should recognize the functions of social workers. The healthcare system should employ qualified and certified social workers. There should also be established regulatory bodies issuing certification and licensing for practice. This will go a long way in fighting the marginalization of social workers in the healthcare experience. This will also be in line with global best practices. The government should equally take a leaf from the Western world in terms of proper remuneration for social workers in healthcare and do the same here in Nigeria. Thank you.
Thank you very much, Ms. Nanyelum, for that nice presentation. So the third speaker will be in the person of Lucky Ekpo. Mr. Lucky Ekpo, please. Your time starts now. Mr. Lucky Ekpo, can you hear me? I think he's here. Ekpo Lucky.
Sir, I can hear you.
Your time starts now.
Hello. Yes.
Yes.
Good morning, sir. Yes.
Good morning.
I'm Mr. Lucky. I want to go. Greeting to everyone. But especially, I'm greeting my reviewer who have worked endlessly into this work. First of all, I want to narrow my mind into the literature review. The topic tells us the role of social work, health care, the study of the University of Nigeria, Osuka Teaching Hospital, Enugu. So let me narrow on literature review, telling us the meaning of literature. It's an overall review of all previous published work on the topic. Now, what is the role, the performance of social worker in the review? The job performance of a social worker is a medical institution refer to the amount of physical and mental health they exert in their working during a specific period of time to achieve the desired input or go through successful completion of various tasks and activities assigned to them when the organization is taking into account the available resources and possibility. The job performance of social worker is also determined in interaction between the behaviors and achievements. The sum of the behavioral result achieved together with the tendency to emphasize achievement or reduce or result due to difficulty or separating of behavior from the results. Now let us look at the roles, which is the job tasks for social worker in medical setting or healthcare team or setting in hospital. Looking at this, I get to understand that the implement role of a business principle, social worker promote the teamwork with doctors and nurses by enhancing the following principles. Now, what are the principles we are looking at now? The principle are counselor role. That is one of the principles which social worker need to look into in teamwork with the doctors and the nurses. Social worker in the role play is a crucial role of spreading medical and health awareness among patients and helping them benefit from the experience of former patients in upcoming the crisis of the disease. With this, social worker play the role they play towards it. It gives counsel to any diseases, letting them know there's life. That is what social worker does not discourage any patient, but putting life to the person by encouragement to patient. So let's for a medical team or the healthcare, the collaboration role. Social workers seek to strengthen the relationship with the doctors and nurses. The social worker relation with the doctors and nurses is vital in contributing effectively to developing the implementing an integral treatment plan for the benefit of the patient by Whitehead 2001. Now with this, with the write-up of this scholar, it tells us that in collaboration, social worker in collaboration with doctors by having a contributing effect by developing and giving integrated treatment plan for the. Hello, sir.
Yeah, you have just 1 minute.
Yes, sir. Yeah, integrated treatment for the benefits of disease. So let's look at the theory and model of it. The theory and model of it is that social worker on the theory and model of it, social worker play in the theory, social worker play, in the model, these are the theories I'm talking about. In implementing this, social worker play a good role by putting a proper theory for supporting the patient and so on. According to Factor 2, people who classify them as order round them into various social categories such as organizer members, guidance agency, and so on. That is
Thank you, Mr. Ekpo, for your presentation. We appreciate for your time. We are now following on the review of one, the person of Dr. Loretta. So please take the floor. Ma, you're welcome.
Thank you, everyone. Thank you, Group 1, for your presentation. I just want to make a quick comment. I'm not so pleased that all the members are not here. And I want to also advocate for those that have found time to be here, that they should not be treated equally with those that are not here. Because I could just imagine a student that knows that this is, an important outing and would not want to be here. Well, that is by the way, but it's a very serious observation. And then another observation is where somebody is called up and the person says, we've shared this work and start making presentation from findings, or because she has decided to look at that area. If you have a group work, you are supposed to be part of the work from the beginning to the end. And you are supposed to master every aspect of the work so that when you are called upon, you should be able to speak. And it has to go logically. The idea of somebody is called upon and then you just jump to findings is very wrong. So please, other groups should take note so that the presentation will make sense. And then another observation, I was saying that they are supposed to have PowerPoint. I didn't see PowerPoint being presented because I was looking out for it to see whether it's well prepared. And I didn't see any PowerPoint. I don't know whether other groups have, but this group does not have, because if they have, it would have shown. Before now, the topic was sent to me to moderate or to approve, which I had to work on, and then we came up with this topic. And then after which they sent their work, and I had to also look at it. So somehow we've been working together, and I made some observations and then so much input to their work, starting from the area of the topic, from the topic to the abstract, which was not well written in the first time, but we had to make it correct, write it correctly, then the introduction and all that. So and then I asked them to do a couple of things, which I noticed that some of those things were not done. One of it is there was no application of the theories they mentioned to their work. It is not just to write the theory and then you don't say much about the theory, you don't also apply it to your work. So please, when you go back, do that. That is the only way your theories will make sense. If you don't apply it to the study, it's like just copying one literature and dumping and say you have talked about the theory. Another one is I observed they did not follow the upper method of referencing. Dr. Teres sent the format to me, and the format is that the students should use 7th edition of upper methods, which I noticed earlier that they didn't use, and I tried to make some corrections for them and left so much for them to follow suit, and I noticed it was not done. So please go back and complete it, because you can't publish a work that will have 6th edition, 7th edition, or whichever edition. It has to be 7th edition because that is instruction. And then coming to your literature review, which you mentioned, the literature review is very important, and you did that. But it was not applied to your discussion of findings. The essence of literature review is to help you when you begin to talk about the findings of your work. And I know I mentioned that to them earlier to do that, but they still didn't do it. So please, when you go back to your findings. Findings is not just to report, because what they did in their work is to just say in your presentation, nobody talked about the methods, material methods I use. The work you use qualitative. Fine, qualitative, you interviewed people. And then the people made their comments, which I tried to put it in italic form for you. And that is not just a discussion of findings. That was just analysis of what you got from your interview. Then the discussion of findings now is where you will now be relating what you found with the empirical studies done by scholars that are in your literature review. Their findings, are they collaborating with what you found, what the other authors wrote in their chapter 2, or are they different? Is there similarities? Are there dissimilarities? Do they agree with your work? Or do they not agree with your work? These are the things that are found in discussion of findings, discussing their findings in line with other people's work that you have in your chapter 2. So group 1, please go back to do that. Because I know that you are going to send back your work to me to give the final review before it is being published. So if you do not do that, it means your work is not complete. Thank you very much. I think I'm done with that because the coordinator, are you with me?
Yes, thank you very much, ma'am.
All right. Okay.
We appreciate those fine reviews. In fact, I want to believe that Group 1 members were following and taking note. And if possible, the same way you were reaching out to your reviewer in the process of writing the work, you can still reach out to her because she's always there for you. We appreciate those fine comments, ma'am. Thank you very much and well done. Without wasting much time,
You can hear again.
What is happening? I can't hear anything again.
oh, hello, can you hear me now?
We can hear you now.
Okay. Sorry, I'm asking Dr. Adejumo is around because he's supposed to review the work of Group 2. Please, sir, if you're here, kindly unmute and speak to us.
Good morning, all. I'm Adejumo, the reviewer for the work of Group 2.
Thank you very much, sir, and welcome. All right. Let's do a quick roll call of Group 2 members. Please respond to your name. Mr. Julius Iwowo. Mr. Julius Iwowo.
Good morning.
Deborah. Please, if you're here, unmute your mic and respond. Okoye Deborah. Chiamaka. Alexander Grace Okun.
Present.
Emekpe Cinderella.
Present. Good morning.
Good morning. Jaja Beauty.
She's not with us.
Like, I don't understand. She's not in Group 2?
No, she was in Group 2, but she said she...
Okay. Nwode Obianuju. Ngode Obianuju Rosemary. Abigail So Emaimo. Yonosa Lazarus. Fatima Abiola. Okay. I don't know what's happening to group 2, but then let's make do with the available presenters, right?
Sir,
Let's
I'm
call on.
here. I'm here. Maybe, sir. Apparently, Rosemary is present, sir.
Hello?
Apparently,
Hello,
Rosemary is
good.
present, sir.
Hello, sir. Kingsley Binoba. I'm in group 2. I'm present. I didn't hear you.
What's your name?
Kingsley Igbinoba, sir. Good morning, sir.
Ogbinoba. Kingsley Ogbinoba.
Yes, sir.
Okay. Okay. But I don't know from what I have.
Good morning, sir. My name.
Apparently.
I'm also in group 2. Yes.
Rosemary, right?
Rosemary. I'm in group. Yes, sir.
Is the Ape Rosemary the same as Obianuju Rosemary?
No, Apa is different too.
What I have here, I don't have Kingsley. The list on my list, I don't have Kingsley. Okay, that's by the way. Okay, that's by the way. Mr. Kingsley, can you start the presentation?
Okay. All right. Good morning, our facilitators. Good morning, moderators. Good morning, our dear reviewers, and also my professional colleagues. My name is Kingsley Igbinoba, and I'm a social worker who trained out of the waters of Nigeria. I trained in England many years ago, and I worked as a qualified social work practitioner. But having come back home, I decided to try and get registered within the Chartered Institute of Social Work. So I'm in group 2. Having said that, our presentation today is on addressing the stigma associated with rape, from a social work perspective. And I would first of all like to define what rape really means. Rape constitutes unlawful sexual activity, or usually sexual intercourse, carried out forcibly or under the threat of violence against an individual. It may be a male or even a female as well, or a minor without their who can make informed consent. Our paper today would explore the ways in which social workers can contribute to challenging the stigma associated with rape. We would also try and discuss the importance of providing comprehensive support to survivor victims by challenging the harmful stereotypes, advocating for policy change, building support networks, and also addressing systematic and societal issues. We will try and understand these strategies and work towards creating a more compassionate and supportive environment for survivors of rape. The stigma surrounding rape is a very complex and pervasive issue that has existed for centuries. Often, rape is rooted in the stigma is rooted in cultural, societal, and historical factors that perpetuate harmful stereotypes and also misconceptions about rape and its victims. These stereotypes in society can lead to victims blaming themselves, self-harming, and then being discriminated against in the society. It has a profound impact on people's lives and is psychologically and socially very debilitating. And it can be argued to reflect social inequality, and also it's a vehicle of social control, according to Parker and Agritte in 2003. Stigma is a major problem faced by rape survivors. It mirrors and replicates prevailing gender inequalities and may be exacerbated by inequality based on socioeconomic status as well. This was postulated by Jackson, Best, and Edwards. Now, stigma has two dimensions. It can be internal and it can be external as well. External stigma expresses perceptions of social devaluation, discredit of persons with stigmatizing condition by others. The internal aspect is about devaluation of oneself, less value, less of self-worth, the feeling of self-harm. These are all the issues. And this was highlighted by Ullman and Wojcicki in their work in 2011. The individuals may experience both of internal and external, and may also find themselves overlaid on other co-occurring stigma experiences. Rape victims or rape survivors have been known to experience mental health issues. The stigma from rape is very prevalent globally, and in some countries, it's so disemphasized. For example, the Democratic Republic, studies show that the Democratic Republic of Congo has a very, very bad rape record. You know, often married women who are unfortunately being raped have even been rejected by their husbands, families, and communities. This was highlighted in the work carried out by Sandilands et al. 2017. Now, again, in some other Eastern countries, Eastern part of the world, places like Palestine, you know, they've been known for honor killings, which is very bad, even when people have been raped. Now, they consider those people to have brought it upon themselves, but that should not be the case. A female should be allowed to dress the way they want to dress, irrespective of, and then where your own freedom starts is where your freedom ends is where their own begins. So societal values of saying, oh, you dress like this, you brought it up yourself, is very, very, very wrong. Apart from the social impacts, stigma adversely affects
Mr. Kingsley, you have to...
Yes, sir. Hello. Were you saying something, sir?
You have just 1 minute to round up, please.
Okay, sir. So it's quite a voluminous topic, but again, a contentious issue as per rape, which I'm a lawyer as well, you know, I'm a lawyer. A contentious issue is what? Does rape, which I find very interesting and intriguing, can rape happen in marriage? Some countries say there's no rape in marriage, but as a social worker coming from the Western background, there can be rape in marriage. But the Nigerian Constitution, Section 36, subsection 12, the 1999 Constitution, says there can be rape in marriage. Well, it doesn't say there can be rape in marriage. It says it's not an offense for rape in marriage. Well, this is a contentious issue. I don't want to be contentious, sir, but I'm just saying that it's good we have a common denominator as to what constitutes rape. And for me, in my training, I believe as a social worker, that rape can happen in marriage. No means no. Even when you've signed on the dotted lines, I believe no means no. And rape can happen in marriage because your human rights also exist within your marriage. Thank you very much.
Thank you, Mr. Kingsley, for that nice presentation. Without wasting much time, we're taking up the second presenter in the person of Mr. Julius Iwowu. Please, your time starts now. Mr. Julius Iwowu. Please unmute yourself.
Hello, good morning, sir.
Good morning and welcome.
Good morning, our facilitators, our reviewers, and our dear colleagues. I want to start by saying that The profession of social work is very important and necessary for the steady survival and continuity of the society we live in. And so the importance of the profession as a helping profession help us to appreciate the objective of the profession. So given the focus of this assignment, the assignment given to us, addressing the stigma associated with rape, social work perspective, as my colleague has already said, rape generally is surrounded or is surrounded with complex issues, and then where it has to do with the victim will live a life of shames and feeling of rejections in the society. So the statement of our study talks about stigma associated with rape is a barrier to victims seeking help. It can lead to feeling of shame, as fear of making it difficult for them to recover from their experiences. And so it is very crucial as for us as social workers to be able to help this individual come out from their feelings and their experience. And so that is the reason why the objective of this study looked at how to find out the primary factors that contribute to the stigma associated with rape, and also to find out the most effective strategies for challenging harmful stereotypings and promoting understanding about rapes, to find out how social workers and also other professionals working with survivors of rape address their stigma and provide effective support. As you all know, as a social worker, as a helping profession, we are saddled with responsibility to help such individuals to live a meaningful life and function effectively in the society we live in. So the research questions here talks about what are the primary factors that contribute to the stigma associated with rape. Please, I'm coming. The stigma associated with rape. I can't really see. So, but in the role of social work in helping the victim, or the role of social work in combating rape victim, is to facilitate or to foster empathy and provide essential services to survivors. The emphasis here on this paper majorly is on the importance of empowering the survivor through legal assistance and also to therapeutic interventions and public and create a public awareness aimed at dismounting harmful stereotyping on the life of the victim.
Mr. Julius, please, you have just 1 minute to conclude. Thank you.
So, as we all know, the stigma that surrounds the rape victims is very harmful, and so we as social workers and the consequences upon them is so devastating, and so that is the reason why we as social workers will have to ensure that we assist them and promote a societal and environmental a good environment for them to actually come out from their experiences and ultimately function well within the society. And because as a profession of social work, we aim at the well-being of individual in the society. Thank you.
Thank you very much, Mr. Julius, for that nice presentation. We'll now take up the third and the last speaker from Group 2, and I'll be calling on Mrs. Rosemary Ape Kamaka. Please, your time starts now. Ape Rosemary. Ape Rosemary is not present. Okay. Mr. Johnson Olamide Ajani. Okay. What about Miss Emekpe Cinderella?
I'm here, sir. Good morning, sir.
Good morning. Yes,
hello.
That's now.
Good morning, sir. My name is Emekpe Cinderella. Yes. Rape remains the
Sir,
we are looking at
sir, sorry, I'm sorry, sir. So I want.
Hello.
Hello. Please continue.
Okay. We are looking at addressing the stigma associated with rape, social workers' perspective. Rape stigma remains a significant social issue. This paper exploits the role of social workers in combating rape stigma by fostering empathy and providing essential services to survivors. It emphasizes the importance of empowering survivors through legal assistance, therapy, intervention, and public awareness campaign. Social workers play a crucial role in promoting justice, healings, and the well-being of rape survivors. According to Jack Bex and Edward 2018, stigma from rape is prevalent globally, but it manifests very between settings. Then we'll look at hello. Okay. Then when you're talking about okay, we'll talk about the implementation and understanding for stigmas of rape. Survivors of rape may be reluctant to disclose their experience due to previous causes, such as social isolation, stigma, or fear of being believed, as in people may not tend to believe them. For instance, they might ask you, what were you putting on? What did you go to do in that place? How did it happen? But as a social workers, first,
You have just
life
1 minute.
experience of survivor, experience of rape, and impact of stigma associated with their experiences. During this paperwork,
Hello.
During this paperwork, semi-cultural interviews, in-depth interview were concluded with participants to explore their experience with stigmas of race, including their perception of the rape, of the stigma, the impact of their lives and strategies for coping. Like when we went to the field, I was trying to
Okay. For that nice presentation. Without
hello.
We now hand over the floor to
Hello.
Group 2 reviewer.
So, like I was saying,
please, your time is up.
Mr. Mbina.
We are not calling on you.
Can you hear me?
Excuse me, I'm not true. Excuse me, I'm on transit.
Yes, ma, I can hear you, please.
The presenter, your time is up. Your time is up. Mr. Mbina, please permit me to say one or two things before we continue.
Okay, ma'am. Okay, ma'am.
The reviewer, please give me a few minutes to quickly call attention to some things. I am beginning to wonder if the presenters understand the criteria for scoring their presentation. So I think it might be helpful if attention is called to that so that others can see how they can align themselves with the requirements. On the score sheet, presenters are expected to begin, or there is a mark allotted to introduction. When you are called upon to start, you should say one or two things about yourself. There is a mark allotted to that. And then there is a mark allotted to your ability to answer questions. So I'm thinking that the reviewer or other reviewers present can ask one or questions so that we can be able to assess the ability to respond to those questions. I just say that their work is qualitative, and in the same breath, she said they went to the field, they conducted interviews, things like that. I think there should be a part where we ask questions so that we can also rate them, because that is part of what is supposed to be rated. And then there is a mark allotted to your slides. Your PowerPoint presentation has marks allotted to it. So if you have slides prepared, please share those slides so that your reviewer can see those slides and give you the mark as appropriate. So those are the three things, please. Introduce yourself briefly. You are supposed to be asked questions, and then share your slides. You have any. Thank you, Mr. Mbina. Thank you, the reviewer, for the time given.
Oh, thank you, ma'am, for calling our minds to that important point. So that being said, for the groups that are yet to present, please, if you have your slides, bring them up and try to see how you can step up your game when it comes to introducing yourself. We are now handing over to the reviewer of the two. Please, sir, you have our attention.
Good morning once again. Please, let's mute our mics. Let us mute our mic, please. Thank you. I want to commend the group 2 for their presentation. At least they've come up with something. But if I'm to pick it from the abstract does not represent everything they claim they did, because the abstract is supposed to be the summary of everything from the beginning, even to your summary, even to your conclusion, which is your chapter 5. The summary, the abstract did not include their methodology or how they get their, the population size and the sample size, the sample frame. The abstract is not the true representation of their work. So they have to work on that. And like what Dr. Olofe rightly said, okay, when I get to the methodology, I will say something on that. I also discovered that some of their abstract, of their in-text citation are obsolete. You are seeing work of 2001, 2003. I believe you could get something that is more recent. And I want to say here that even the presentation of the first presenter is richer than the work they sent to me. I don't want to say it, but let me just quickly put it in that I was forced to ask them for their paper, for their work, which was not sent on time. Then looking at their statement of problem, it doesn't prove any problem. In fact, they didn't even mention anything about it. The work did not show any problem. It's not something that we jeer policymaker up to do something about the work, that it doesn't show that there is any problem. Although I'm going to send back the work which they sent to me. And again, looking at the methodology, I was taken aback when I was reading and the person said they use structured interview, and also saying that they use unstructured interview. In fact, there is a name given to it. Let me quickly get it. And I was asking myself, Which one is this? Methodology, chapter 3. Just give me a few minutes just to get there on my system. So it shows lack of preparation, even from their presentation. It shows lack of preparation. And again, okay, he said data collection. He said semi-structured interview. And when you are explaining your semi-structured interview, you said in-depth interview were conducted. So I don't know what in-depth interview has to do with semi-structured interview. Maybe you don't even understand what is meant by that. And you dwell more. In fact, it got to a point I thought you are talking on, you are working on mental illness. That took the most part of your work. You are just talking about mental illness, and what you are talking about, your work is actually on stigma that is associated with rape. But you are not talking about stigma associated with mental illness. In fact, I asked there, are you working on mental illness or you're working on rape? On stigma associated with rape. You lost track of what you are doing and you delve into another area entirely. So you may need to look at that and go back to track, and many of your work here lack source, as in citation. For example, under your trauma-informed care model and stigma, you just put everything down, trauma-informed care, no citation. I put by the side source. Who said it? And the theory you claim you have used were not related to your work. You did not associate them to the work you claim you have done. And I could not see anything, any figure, anything representing even the field you claim the field work you claim you did. It doesn't show that you went to field at all. It doesn't show anything. I don't have record of the number of people that were studied, that were interviewed, their age, the type, nothing, no record. So this work is not done. I believe it's supposed to be an empirical work. And I could not see any sign of going to field that shows that the work is empirical work. Yeah, you could go to field even when you are doing qualitative work. Yes. The only difference there is your way of analysis. You talk about semantic analysis, but I could not see how you state your themes and what you came out with from each of them. So it is not a work that is done. It's like you just copy one literature, one work that has been done, you just dump it here. Because there is no sign of you people going to the field from this work. And I'm telling you, this work cannot be published the way it is now. You have so many lists of authors under your references, but many of them did not appear in your work, in your interest work. We have to look at that too. And like what Dr. Lofe said, this is part of what you are meant to do here. If you fail this very aspect of this course, you may not be allowed to even graduate or to do your induction, because this is what you will further continue to do. After now, research and research and research. Even in your day-to-day work, even if you are practicing, you still conduct research. And the way this work was done is not the way research should be done. I will tell you here that the last work was sent to me even on yesterday, I think yesterday morning, and I was able to go through it, and I was able to put down the correction by the side of the work. So the group leader and the other members of the group, we still have a lot to do if you want this work to be published, and you still need to go to the field and do what is needed to be done. And if you have your report from the field, maybe you need to, input them into the work you have done. Like I've said, I did not see any sign of you going to the field, no record of your respondent, nothing about them, and you said you conducted interview. So please go back to this work and let's have a more robust work. We continue from now. Maybe after this class, I will send this correction to you. Then we continue from there and see how
It's
we
okay,
can make
sir.
it better. Thank you, Mr. Mbina.
Noted.
Thank you immensely for that nice presentation. We appreciate your wealth of experience as far as the area of research is concerned. Please, I will now leave the floor open for questions. The floor is open for questioning. Please, let's feel free to ask questions. And before that, earlier on, I tried to call names of group 2 members. Maybe I relied on
Hello.
So let me
Hello,
call
sir.
in and yes.
Hello, sir.
Can you hear me?
I can hear you, sir. I wanted to ask a question and also make an observation.
Don't worry, you'll be given an opportunity. It's time for us to ask questions. You're a member of group 2, right?
I'm a member of group 2, sir. Yes, sir.
Just hold on. You have the opportunity to express consent. But
I should hold on. I should hold on. Okay.
Just hold on.
Yes, thank you, sir.
All right. Please, group 2 members, react to your name. Mr. Lazarus Damlo. Mr. Lazarus Damlo. Okay. Kingsley Genoba.
Present, sir.
Ms. Sape Rosemary.
Present, sir.
Nwode Obianu.
Present, sir.
Emekpe Cinderella.
Present, sir.
Chiamaka Deborah. Okoye Chiamaka Deborah. Okay. Odubide. Ekem Julius Iwowo.
Present.
Ekem Julius Iwowo. Okay. Alexander Grace.
Johnson Olimide is on transit, sir.
Alexander Grace.
Present, sir.
Alexander Grace.
Sir, good morning.
All right. Good morning. All right. So now let's react to some questions. Let's see if there's any question from both the reviewer and your colleague. All right. In the absence of any question, please kindly mute your mic. If you're not speaking and you're on mute, please mute your mic. Okay. Thank you. Now, the thing is, one thing you should understand. I feel we should get this understanding to appreciate what we are doing here, right? Social work is one of those professions and discipline where no matter where you find yourself, you must continue to indulge in research. One of the major rules of social work is advocacy, education, right? So after embarking on research, you must have the ability to translate or convey whatever findings you've made in the field to educate people, to create awareness, to advocate. And it's sad that we're having a presentation of this nature and we don't have any slides. And funny enough, we are assessing you on that too. As a reminder, other groups that are yet to present, if you're coming to present, if you have your slides, feel free to share them. Now, without wasting over words, and in the absence of any further question.
Yes, sir. Just a minute, sir. Hello, sir.
Okay.
Sorry to have interrupted you, sir. I just wanted, I'm a member of Group 2. My name is Kingsley Igbinoba. I want to thank my reviewer and as well, and all the reviewers, Madam and the other gentleman, Dr. Adegboyega, and yourself for the positive criticism, sir. I want to say we take on board what you've said, And I don't know what the time span is for us to resubmit the work. And of course, to respond and also impute, especially the corrections that have been said from our reviewer. Do we have a time? I'm looking at the time because we have one again next Saturday, which is an exam. I don't know when is the deadline we can submit the work, sir.
Okay. As for the deadline, you would communicate with your group reviewer, and in this case, we are talking about Dr. Egboe, right?
Okay, sir. Okay, sir. Thank you.
And try to see how you can live.
Okay, sir. Thank you very much, sir. Thank you.
Then it's now time for group. Quickly react to those. Please. Group 2 members, please react to those issues raised. For example, you don't have a slide, any explanation. I also remember the reviewer said first speaker's presentation is far better than the work. In fact, when the first speaker was presenting, in my mind, I was like, I hope what this man would say or what this woman would say, I hope if we're able to translate it, I hope we can get it. Because the presentation actually looked great. And I was surprised when your reviewer said your presentation was better than the work. So that means you've got something elsewhere to present is different from what you have in your work. Can you defend that, please? Can you defend that, please?
Okay, sir.
Well, hello. Hello.
Yes, who is speaking? Introduce yourself.
Yes. I want to thank our reviewer.
Lucky Echo, please, you're in group 1. Hold on. Okay. Hello, Mr. Lucky. Mr. Lucky Echo, you're in group 1. I asked for group 2 response. Hold on, please. Let's be organized here. I want to believe we are all mature. Okay.
Okay.
I want to. Hello.
Mr. Lucky Echo, please hold on.
Okay, sir. My name is Kingsley Igbinoba, sir, Group 2, sir. Can I respond to what you said?
Please go ahead.
Okay. Thank you very much, sir. I want to again say we do appreciate the criticisms. I joined the group I only joined the group last week, and I see that they put in a lot of work. But I'm going to combine with them now so that we can put it in slides, methodologically, so that it shows that the presentation would flow. I mean, so that the moderators, the reviewers can see what we're talking about. That's why I was asking for the time span, sir. We'll put in slides, and like Madame said, I can't remember Madame's name, but I'm sure the reviewer, she's a doctor, and she said also that it's important to relate your research to what practices, and also to relate the theories to modern day practice. So we will try and link theory to practice. But again, sir, with rape issues, it's a very, very sensitive topic. And in terms of having to talk to people who have been affected by rape, not everybody is always willing to talk about it. And that's part, as a social worker, we also need to practice in a way that is not seen to be oppressive. I believe in anti-oppressive practice. So we will try and see how much we can get. But in saying that, sir, can we rely on secondary research in terms of, video recordings of people who their faces were blurred and then they're talking about their experiences? Would that be enough?
There is no problem. With that. Just all you're expected to do is to relate whatever concern you have with your reviewer, okay? And also explain to him how you're going to go about it, and that will be fine, okay?
Okay, sir. Thank you very much.
Hello.
Thank you. That's okay for number 2.
Hello.
Who is speaking?
Mr. Julius is speaking, please.
Okay, Please, let's hear you.
I want to thank you sincerely and thank our reviewer. Though we appreciate actually the fact that we are doing this exercise because, like you rightly said, social work generally goes with research because research is very important in the field of social work. And you see, this work was done in a hurry. And I want to thank God for this opportunity given to us for us to go back and then look into the work properly. And so we are
Thank you very much. Thank you very much. Thank you very much. Okay. Okay, Dr. Juma, please.
Can you hear me?
Hear you. Yes, sir. Sir, please go. We can hear you. Hello, sir.
I think this is not an avenue for somebody to just come up. We just accept whatever your reviewer said, then speak with your reviewer after now. It is not an avenue for you to give one excuse or the other.
Thank you very much, sir. Thank you very much. So that's all we can take for group number 2. And the reviewer for group number 3 is unavoidably absent. So without wasting much time, we'll be taking group number 4. Members of group number 4, I hope you're all ready. As usual, I'll quickly do a roll call to mark attendance for group number 4.
Okay.
Group number 4, please. We have Ozioko Cynthia. Group number 4.
We are here,
Cynthia. Okay. We have Adetoba Glory Crown.
Present, sir.
Dongo Daniel.
That person didn't surface as a group member, sir. We are supposed to be 9, but 7 people.
Please, we don't have time for that, okay? Naomi Chinyere.
Present, sir, but the hospital admitted, sir.
Okay. Suleiman Khadija Adiola.
Not a group member.
Akolade Olatunde.
Not a group member.
Olusola Olajide.
Present, sir. Olusola Olajide, present, sir.
All right. You have the floor. And I'm calling on.
I didn't hear my name, sir.
Olajide. I'm calling on Olajide to start the discussion.
Sir, I didn't hear my name, sir. I'm a group member. I didn't hear my name.
Who is speaking, please?
Odema Theophilus Chimeze.
Okay. Please,
I didn't
the last question.
My name is Benga Urukuto.
Olajida, please take the floor.
Okay. Good morning, Maz, our reviewers, and my colleagues. We have the topic to be influence of religious beliefs on participatory community development activities in Ogun State, Nigeria. I believe we are to talk on the 3 main things briefly, which is abstract and introduction, data, materials and methods, and recommendations and conclusion. So, sir, I believe since you're calling me, I'm to talk on abstract and introduction briefly within 5 minutes. So I start. Today, my group and I will discuss how religious beliefs have been able to impact community development in Ogun State, Nigeria, focusing on Ibogun, Olaogun community compared to a neighboring area. The purpose of our study. The research aimed to understand the reasons behind the lack of consistent electricity and clean drinking water in Ibogun, Olaogun. It also explored the role of religious beliefs and metaphysical views in community participation and development. Methodology. We used a descriptive survey research designed to observe behaviors and attitudes within the community. 2 hypotheses were tested, both of which were rejected, indicating a significant influence from religious beliefs. Our key findings. 1, religious influence. The study found that both religious belief and metaphysical views positively contribute to community participation in development activities. 2, engagement level. Community members who actively engage in religious practice are more likely to participate in local development efforts. Our recommendations. On sensitization programs, we believe that NGOs and stakeholders should implement awareness programs to educate the community on the importance of participation in development. 2, literacy initiative. Strengthening community ties through literacy programs can enhance involvement in local development efforts. 3, role of religious leaders. Religious leaders should recognize their influence and work collectively with other stakeholders to achieve developmental goals. We were able to, under this abstract, I would say that religious beliefs significantly shape community engagement in Ibogun. By leveraging these beliefs, stakeholders can foster greater participation and ultimately improve community development outcomes. I'll talk about the introduction real quick, since it's part of what we are to discuss. I'm presenting an overview of how religious beliefs were able to affect.
Please.
Can you hear me?
You have just 1 minute to round up.
I'm rounding up. So under our objectives
You have
of
just
study,
1 minute.
Yes, I got that, sir. We were able to investigate the reasons for the lack of electricity and clean waters in Ibogun, Olaogun, and Abalabi community. So conclusively, I would say that this study was able to uncover the intricate relationship between religious beliefs and community development, whilst emphasizing that effective development cannot overlook the influence of religion. Understanding this connection is essential to fostering meaningful participation and achieving sustainable growth in Ogun State. Thank you for your attention. Thank you, sir.
Thank you very much for that nice presentation. We'll now be calling on the next presenter from that group 4. And in this case, we'll be calling on Dongo Daniel.
Sir, Dongo Daniel is not a member of our group, sir.
Okay, please, whoever is take up.
All right, sir. My name is Glory Crown Adetoba. Let me take up next section, which is material and methods. For us to get the data that we use to run our hypotheses and make informed conclusions, we designed a Likert type questionnaire that was administered to, we planned it for 100 respondents, even though at the end of the day, we could only administer it to 60 respondents, reason being that that time was a period of holiday, so we couldn't reach many of the respondents. Schools, it was during holiday and schools were out of session then. So the questionnaire was administered and it was given to those students. Apart from the students in those 2 communities, students were it was given to students because, number one, we believe that they are the ones literate enough to fill out the questionnaires and they are of age enough to understand what the questionnaire or what the research was about. Apart from that, we had the gatekeepers of the 2 communities also as part of people that we harvested information from. And we also analyzed their responses. So that's about the population for the study. Our sampling technique, the sampling technique as I explained before, 100 questionnaires, there were 2 communities, and the questionnaires were divided between them. That's 50 for each. The rationale for that sampling, as I said earlier, is because the people listed, they are the surest providers of answers to the questions that will help us uphold or nullify the hypothesis. As the first speaker said, at the end of the day, all our hypotheses were rejected because of the outcome of the research instrument. The research instrument, that is the questionnaire, the first aspect dealt with demographic information about the respondents and about their areas of residence, while the second part consisted of closed-ended questions for the purpose of answering the research questions stated in chapter 1. And the research instrument was, of course, validated. We had the help of some professionals to help us in the validation. So, and we believe that because of that, the research instruments were reliable for us to make our conclusions in section 4. Now, the method, it was a qualitative data collection procedure, and in the situation that the respondent was non-literate, that's for the gatekeepers, because some of those chiefs and some of those gatekeepers were not literate. We had them assisted in filling the form. Now, method of data analysis. After the collection of the questions, we collated and scored accordingly. Simple percentage counts and tables were used to analyze demographic information, while simple linear regression was used to test the formulated hypothesis at 0.05 level of significance. That was our data and materials and method with which we analyzed our data.
Thank you. Thank you, Mrs. Crown. We will now be taking up the next presenter in the person of Benga Orokotan. Please, the floor is yours. Is Benga there? Benga is absent.
Benga is around.
Please, Benga, kindly unmute yourself and speak.
Hello.
Hi.
Yeah. Thank you so much, sir. My name is Ben Garuk. So I'll be taking the conclusion part of
No, Benga, can you move closer to your mic? I can barely hear you.
Okay, I'm with my mic.
Okay.
Hello?
Yes.
All right, sir. So, in conclusion, we understood that the community participation and engagement are vital for socio-economic advancement in the contemporary setting. So, the studies demonstrate that while historical communal value once facilitated development, modern community must adapt their strategy to include both traditional value and contemporary practices. So, a key decision as regard to a key conclusion as regard to this study, we look at the importance of participation. So, the study found that active community participation is very essential for success. So we also see that the role of metaphysical beliefs significantly influence community development. Why this? We have historical shape society norms and impact, modern development needs to be understood and managed to ensure the support the situation rather than hinder the progress. So in our recommendation on studying findings, the following recommendations were proposed: that educational initiatives like NGO and other related stakeholders should launch educational programs to raise awareness and the benefit of collective action for sustainable development. This aim also to dispel misconception and promote the advantage of collaborative effort in community growth. So we also recommended that strength community participation should be also looked into. So effort should be made to enhance community involvement in development activities. And 3, we also look at promote equitable resources distribution. So leaders should advocate for promotion of alternative energy source that benefit all community members. So we also suggest that further research or future research should be made to exploit the following areas to build on this study that we have. Influence of community association, to investigate how different community associations contribute to the growth.
Please, you have less than 1 minute to round up.
So
you have less than 1 minute to round up.
All right, sir. All right, sir. The role of community leader also should be examined to how its impact on mobilizing and engaging members of the society for development. So I believe this should be looked on to and provide deep insight into the dynamics and development and formulation of effective strategies. Thank you, sir.
All right, thank you very much for that presentation. And like I said earlier, the reviewer assigned to group 4 is unavoidably absent, and I'll be standing in for Dr. Atere. Once again, Naita, I'll be reviewing the work of group 4. Yes, when this work was sent to me, I immediately opened the work and I noticed in the first place, I didn't even see your topic. No cover page, no table of contents, no abstract. In fact, no preliminary pages. Please, that is totally unacceptable. Although, when I raised concern, was it yesterday or in the morning, I saw an updated work. And I also noticed that just like the other groups that presented earlier, you didn't come up with any slides. I don't know why. Going forward to your chapter 1.
I'm sorry, sir. Can I respond?
No, you cannot.
Okay.
Thank you. Your chapter 1, your introduction is looking like the background, and your paragraphing is 4. At least my own opinion, you can just make your points under this introduction in just 1 or 2 paragraphs. And in each of these paragraphs should contain at least 7 to 12 lines. But what you have here is an entire page or 1.5 page paragraph with no references at all. That is too poor. Your 1.1, which is supposed to be background to the study, is presented as background of the study. Please take note. And your background to the study is not how it should be presented. In your background to the study, you're expected to inform your readers on what community development is all about, how religious beliefs can influence community development, giving your readers a global view of the problem by citing some scholarly work from maybe Asia, Europe, Africa, and then finally narrow it down to Nigeria. This will enable you to justify the fact that what you're writing on is a known problem, not just here in Nigeria, but in the entire world. So make sure you always reference the work you're lifting ideas from, because writing without proper referencing is totally unacceptable. And take note of this, because you still need to make this correction for this work to be publishable, right? Now, going forward to your statement of the problem, your statement of the problem should not have any in-text citation. All you need to do is to tell your readers the ideal situation, the real situation, and how this study seeks to address the problem. Now, the idea is you're going to cite someone in your statement of the problem. You're not making it look like it is that scholar you're making reference to that is identifying the problem, not you, or making the statement of the problem, okay? So before embarking on this research, it is believed that you have a problem you've identified and you're looking at embarking on this research to address that problem. So under this statement of tell your reader that going forward, your 1.3 is presented as objectives. Please take note. It's supposed to be objective of the study, right? Now, your study should have 2 main objectives, or your research objective should have 2 main objectives, namely the broad objectives, specific or main objectives, right? Furthermore, you can't be embarking on a study of this nature without making references to the role of social work. Please, this is not acceptable. Fine, your first 2 research objectives, 1, to examine the influence of religious belief. The third one, to explore the perspective of community leaders. So, where is the place of social work? Now, going forward to your research question, you have just 3 research objectives. Mind you, earlier on under your 1.3, which is your research objective, you have just 3 research objectives. So how come under your research question, you have up to 5 research questions? So where did you get those research questions, other 2 research questions from? Please, you have to rework your research question, because your research questions should flow from your research objectives. What you have in your research objectives should be presented as a statement, while what you have in your research questions should be presented as a question. And they should be in tandem, right? Going forward, in paragraph or in 2 paragraphs, the significance of this study in a way that it will capture the theoretical and practical significance in just 7 to 12 lines each. Just in 2 paragraphs, tell your readers the significance of this study and
Okay,
highlight
take that too.
highlight theoretical.
Then I have a PowerPoint on the share. We have PowerPoint too. Mana,
Hello, please, please,
maybe
Mrs. Nonye,
for others.
kindly mute the mic, okay? Nonye, please mute the mic. All right, all right. Going forward, we'll now be looking at your chapter 2, review of related literature. Your review of theoretical literature is poorly written. Please review scholarly work related to this study in a way it will address the research questions and objective of this study. What you have here as a review of related literature is just 1, 2, 3, 4 lines. That is what you have as your review. This is totally unacceptable. This is not how literature review is expected to be presented. I wonder what you'll be having in your discussion of findings when your review of literature is just a 4-line paragraph. This is just too poor. You need to go back and rework this part. Okay? And 2.1, perspective, theory, and model. In fact, your citations are just too old for my life. What happens to new research publications? At least 2018. Okay? Stop looking at old publications. You're just recycling old ideas. They are updated knowledge. Why not keep tabs with this new publication? Like reference. And this is not how your theories is supposed to be presented, right? Start by telling your readers of that theory. Lucky, your mic is unmuted. Can you please mute your mic? It's seriously. Thank you. So, in reviewing theories, you're expected to tell your readers the proponent of the theory, the year it was propounded, the basic assumption of the philosophy of the theory, criticism of those theories, and scholars that have succeeded or that have used the theory in a similar study. That's how, if you present it that way, you would succeed in adopting that theory to this study. But you failed in doing that. So please, I would employ you to do a good job there. So even when you come to your structural Marxist theory, I still say the same thing, that you should see the correction I made in the first theory and apply the same idea here. All right, we now come down to your empirical review. And in fact, from your seminar format that was given to you, there is no need for empirical review. All you need to do is just to review related literature. So what you're expected to do is just to review literatures based on your research question and research objectives. So this empirical literature review is not even necessary. It's not needed. You can just collapse it. It can come under your review of related literature, okay? I keep seeing references from, like, for example, the one we have here, I think Econ 1988. Please, it's too old. Rely on recent journals, right? Then your chapter 4, please. I want to believe that from your presentation and from this seminar work, you're done with this research. But you keep making statements like you're yet to embark on the study. You keep making statements like you are proposing. This is not a proposal. It is believe you're done with this research. So stop making sentences like you're proposing. It is believe you're done with this work. For example, you said under your research design, you said a Likert scaled questionnaire has been. You now say descriptive survey design method will be used. So all those statements is sounding like or making it look like you're just proposing and you're yet to embark on the study. Now, under your population of the study, you said the population for the study are community members of Ibogun or Lagoon community. Now, I don't know where this is coming from when you didn't even capture it from the beginning, even from your topic. So this should reflect in your topic to capture the actual area of study, because having your topic the way it is being presented makes it look vague, right? You also said 50 respondents from each community were selected, making a total of 100. Now I'm asking, how were these respondents selected? You should also tell your readers how you were able to select these 50 respondents from each community. You did not mention anything about that here, right? Mention the specific method of data analysis you adopted in analyzing the data from these respondents. Because you just said a passive statement like the data collected from all will be analyzed as it is done in survey descriptive research. Who does that? We don't have just one way of doing things. So tell us the specific method you adopted in analyzing these respondents from your responses from your respondents. Now, sampling and sampling techniques. You say the quarter sampling method will be used in this research, work for all categories of the research population. Samples will be taken from common community members, traditional rulers, and what's more. I now ask, which sampling methods did you now use to determine those to be interviewed or those you interviewed? You should also tell your readers, apart from selecting these persons, what methods did you now use to select those you interviewed? Because by sampling method, you're not telling us that, okay, fine, you would use quarter to say, okay, fine, from this group of people or from this area, I will get 50, from this area, I will get 50. Now, it is believed that we have more than 50 people in this particular cluster or this particular group. Now, while approaching this group, which method did you adopt in assessing these 50 people that were your main target that constitute your respondents? Going further, you said data collected from all respondents will be analyzed as it is done in survey descriptive research. Please, this is not a research statement. Cut it off and specifically mention how it is done in research, descriptive research instead, and the method you adopted, right? Then under your rationale for sampling, for sample selected, you said a rationale consists of a line of reasoning that performs two principal functions. It describes a context within which to locate the intended project and suggest why doing such study is worthwhile. Please, a clear example of plagiarism is not far from this. If you're making references to anybody's work, please, it is expected that you reference that person, and it is a crime. So this is totally unacceptable. You also made statements like the rationale for using sample detailed in section 3.2 is because, please, spell it out. Especially in this situation whereby your 3.3 is not even correct and you're still referring your readers to go to 3.3. That is totally unacceptable. All right. Just before your concluding line, just before your 3.5, which is research instrument, you concluded by saying an African adage says, the land of Ife, a city in Oyo state of Nigeria, was created with wisdom of the elderly. There is no connection between this statement, this proverb, with what you're saying, because you failed in connecting or creating that nexus. And I presented this way instead, that the imports this carries is that solutions to community-based problems in this millennium are technologically based, or tapping into this will involve the educated youths of the communities. This is in line with the African adage that says that land of Ife, that is a city of Oyo State in Nigeria, was created with the wisdom of the elderly and the youth. So you now see that there's that connection between that adage and the idea, thereby driving home your points to your readers. You also under your research instrument, you said this is, you said the details of the questionnaire can be seen in this attachment. But in the end, I checked around, I didn't even see any question, I didn't even see your questionnaire, I didn't even see anything in your appendix. Your validity of this research instrument, you were just making references without even, will I say, making taking into consideration the upper or the 7th edition of the upper style of referencing. Please do well to see the 7th edition of the upper style of referencing. Just like one of the reviewers said earlier, you need to be consistent. If we are adopting the 7th edition, make sure you are consistent with the 7th edition. We can't be doing, we can't go forward with using 6th edition, 7th edition like that. No, we must be consistent with one. And the statement you made here is a clear pointer to the fact that this work was copied. Why mention hypothesis when this work does not have a hypothesis in the first place? In fact, this work was copied from the Faculty of Education, University of Lagos. That's to tell you how poorly written this work is. You fail to even go through it, and you happen to copy it the same way it is, and you submitted it the same way. Please now, you can do better than this, okay? You also made a statement that to achieve validity, the instrument will be subjected to approval of the supervisor. Did you even send this work, or did you even send your questionnaire to your supervisor or your reviewer? I want to believe you did not. You did not. Under your data analysis, you said you claim to use this method of data analysis, yet there is nothing to show that in this work. And this shows the level of which you copied. So please, you need to work on that too. And be careful of how you play with numbers in research. You were busy playing with numbers without table of figures to display how the responses your respondent supplies you you were busy discussing and quoting numbers without those tables to show how those responses applies to your discussion. So please, that is wrong, okay? Again, why are you testing hypothesis when you don't have hypothesis in the first place? And your summary, your summary and your conclusion, you collapse everything. Summary, conclusion, and recommendation, you just collapse everything in one. That is wrong, okay? You have to separate them, okay? And your conclusion, you need to collapse them. Your conclusion is not supposed to, you're not supposed to itemize or number your conclusion. It makes it look like recommendation. So collapse everything, and then your recommendation is not reflecting or is not capturing your research questions and research objectives. So your recommendation should be in line, in tandem with your research questions and your research objectives, right? And like I said, just like you didn't have preliminary pages, you didn't even have list of references. Although in your last work, the last work you sent, when I opened it, I saw your references, which is not still in tandem with the 7th edition of the upper style of referencing. Please, having pointed out all this, I would like you to go back and do the needed adjustments, correction. And if you do this, I believe, and I strongly believe, that this work will come out better than the way it is. Thank you for your time. All right. Can we now welcome questions from both the colleagues of Group 4 and other reviewers? All right, for the want of time and in the absence of any question, let me just ask this, please. Why didn't you come up with a slide? This question is for Group 4 members. Why didn't you come up with a slide? I want to believe I can be heard. Hello?
Okay, sorry, I was talking. I didn't know I was muted. Actually, we came up with slides, though it was sent lately, it was sent yesterday. And if not for the fact that I only have my phones here with me, assuming I was with a laptop, I would have been able to send it to this Zoom meeting, just as you instructed. So that's the reason. We made slides and it was sent to our reviewer.
So you're supposed to share it, right? While presenting, you're supposed to share your slide. Is that clear?
It's in the well, I think the WhatsApp group, just like the full version of our paper presentation, the Word version, is in the WhatsApp group.
Hello, can you hear me?
Yes, sir.
Fine. You are supposed to share your slides while presenting, okay? Just take note of that.
Yes, sir.
Now, I want you to respond to this. The group leader, possibly the group leader, should respond to this in line with all what has been pointed out as far as this your seminar is concerned. What do you intend to do?
It's okay, sir. I have noted all that you commented, sir. We are going to take everything into perspective and the group will work on them. As I was going to say before, the full version of almost immediately after sending the version, our reviewer just asked for our work and I explained to him before sending that. And in some few hours time, I sent the full version of work to him. So then another comment I want to make is you were talking about tables and all those stuff. It's because we were given those number of pages, 25 marks. So we couldn't bring up all those tables under section 3, which is materials and analysis. So that's the reason for that. But God helping us, we'll see how we can just work on all your corrections and then we resubmit by the grace of God as soon as possible.
Thank you very much for your nice presentation. We will now be taking up the presentation of group number 5. And I want to believe that...
sorry, before you take group number 5.
Sorry, sir. Hello, sir.
Please, who is speaking? Who is speaking? All right. Okay, I heard the voice of Dr. Atere. I think he is here with us.
Oh, yes.
Okay, sir.
Thank you very much for stepping in. Social worker Bina Ita, the moderator. Let me apologize to the whole house that I'm meant to be in this meeting, but because of other assignments which I am on, I couldn't join. And even now, I'll be coming in and going out. I will not be so consistent within this meeting. Group 4 actually sent in their last correction. I think the problem was because they were just submitting and canceling, and that is not good for us. So I told the group to just hold on, let's finish this one before they will not be able to correct all that will be pointed out. I think now that it will be pointed out, since I've pointed out to you, just go back, ensure you effect all the corrections, and then resubmit back so that we can look at it. Actually, to say that 25 pages is not enough would be an overstatement, because even when you are presenting your data, there is a multi-table concept that you can use that will take one page that will consume all your data rather, so that you will not looking for 5, 6, 7 tables that will take your space. So in a situation like this, we use a multi-table concept. One table that you'll be able to now put in all your data at various level of your
of your information. So that's for that. Again, we would like to all the participants, please try and do original work. I also saw one from what Shokan Bina pointed out. People are going to copy people's projects. I even saw one that vexed me. I just stopped reading it. Why? Because it was somebody's project. Even the name of the school where the project was taken was on that paper that was submitted to me. And that is not what we want to achieve. Now, research work is what you do every day as social worker. The moment a service user enter into your facility, whether it's district department or agency or wherever, research work has started. And many of us are already working as a social work desk officers one way or the other. And we have handled so many projects in our office. We have added so many service users in our offices. From building rapport, to assessment, to whatever you are doing with the person. All those things are research concepts that is done at the domain of the clinic or your agency. So some people told me that they don't have time to go and be doing questionnaire. You don't need questionnaire for this type of work. You don't have that time for it. You use a secondary questionnaire, secondary data. It already have been prepared. That you have already worked with in your offices. One of you will just bring what has been worked on and talk about those. That is what we expect. We are not expecting pure academic research. We are expecting clinical research. There's a difference between academic and clinical research. A clinical research is what you are doing day to day, activities you are carrying out day to day, interventions you are carrying out day to day. And many of you have those data in your offices that you can pull out and use and just use the literature review to back yourself your work up. And I also learned that some of you are even giving this research to somebody you are contracting it out, which is unhealthy for us. That is not our plan for this type of thing. You don't contract this thing out because that is what you do on a daily basis as social work desk officers. To search for literature for your literature review should not take time. You are 10, 11. The topics you have been given, you have agreed on it on your own. Nobody forced any topic on any group. You have your topic written by you that you want to carry out. Then divide amongst yourself on how to search for literatures. Your chapter 3, the materials method, is something you already have in your offices that you are working on. So I don't see how we should be contracting a thing like this out to people or copying somebody's work and you feel we will not know. We have also passed through this stage and there's no way we will not know. Even if the name, we didn't discover the name on your paper or within the paper you are writing, we will one way or the other find out and we will see. Please, our aim is that we want publishable papers to come forth from this. So corrections that are coming forth during this period should be taken serious. I hope that each group have rapporteurs who is taking the corrections substantively so that you will be able to adjust to what you have done. And at the end of the day, we want these papers published. Dr. Boyega Adegboyega is here. He is in charge of the publication. So paper written that is not up to standard will be thrown out. So try as much as possible to ensure that you do good corrections, and then we could go on from there. If you want a paper to be published, you contact him. You contact Dr. Adeji Maboyega so that at least he can also take it forward for you to publish. So thank you very much for now.
Thank you, sir.
Moderator. Over to you, sir.
Okay, thank you, Dr. Tere, for coming in and for helping us to see most of the gray areas we need to pay attention to. We appreciate that, sir. So without wasting much time, let's go. Let's now take up the presentation of Group 4, or Group 5 rather. Group 5. I want to believe the reviewer for Group 5 is with us.
Very well, sir.
Okay, he's okay. Please, Group 5, the floor is yours and your time starts now.
Good day, House. I am Aderupoko Dipo David from Group 5. I acknowledge the presence of our reviewer, Dr. Adekalu, and other social workers on the group. Our topic is the role of social worker in enhancing community well-being in Nigeria, a case study of Ebute Meta. Primarily, our research is an evaluative research. Typically, an evaluative research seeks to clarify the nature of a phenomenon, which could be a natural or a social phenomenon, thereby creating potential hypotheses for further research. And such further research could be a correlational research, in which case we are trying to identify corresponding relationship between variables, or an experimental research, in which case we want to identify cause and effect between the independent variables or variable and the dependent variable or variables. Specifically for our own research, for this purpose, we'll be identifying two important variables. The first, which is the role of social worker intervention as the first variable, and community well-being as the second variable. Although, because it is an evaluative research, we don't intend to create any corresponding relationship between them. However, we want to identify patterns between these variables. The objective of our research includes, number one, investigating the impact of social work intervention on community well-being in Ebute Meta, identifying the challenges of social work practice within that region, and to explore best practices. Of course, every research is informed by theoretical models, two of which we identified. The first being the ecological system theory, created by a child developmental psychologist named Ure Bronfenbrenner. The idea of the theory is person in environment, in the sense that he posited that persons are systems and the environment are systems, and that environment can affect individuals in such environment to the extent that it can make them functional or dysfunctional. It is relevant to our work because Ebute Meta constitutes of individuals living in the community. These individuals are affected by their community and the availability of resources in the community. The second theoretical model is community developmental theory, created by Caseman and Mark Knight. The entire point of the theory is that as social worker, we must focus on identifying the strengths and the assets of communities rather than the deficits, and empowering them to independently function even in our absence. This is relevant because the role of social worker could help the dwellers of Ebute Meta function independently. The literatures we reviewed, the empirical studies, suggest that there is a positive relationship between social work intervention and community well-being, not just at the national level in Nigeria, but also on a global scale. The materials and method we used. Our research design, as earlier stated, is an explorative design, and our participants include 30 social workers, in which case we made use of a purposive sampling, The goal of a purposive sampling is to identify specifically certain individuals that have some attributes. In this case, social workers who have at least 3 years experience with community services. We also made use of a random sampling for interviewing 100 community members in Ebute Metta. The goal of a random sampling...
Can I interject, please?
Yes, sir.
Sorry for interjection. You are the group leader, right?
Yes, sir.
Okay, you are already you are flowing into the space of your group members who are supposed to be presenting. The group leader is expected to just introduce. Materials and method is meant for the second person who will be presenting. So you start there, let the second person be called. You have done a beautiful introduction. So let the moderator call the second person on the materials and method, then the third person, conclusion and recommendation. That's how it flows. Thank you very much, please.
Okay, thank you, sir.
Okay, thank you very much, Dr. Atere, for that. So we're now calling on the second presenter, and I'll be calling on Agbro Michael. Agbro Michael.
Okay, good morning, everybody. Good morning, our facilitators, moderators, our reviewers, and our supervisor, Dr. Adekalu. So are we permission to share my screen? Mr. Dave, you can remove your screen so I can share mine if I have that permission. Ade?
I'm sorry, I wasn't the one who shared the screen. It's almost a that shared the screen.
Okay.
Okay, I think it has been removed now, so you can share yours.
Okay. Okay, so can you see my screen?
Yes.
Okay, so let me just move to, do I start from, okay, let me move to the materials and methods.
Yes, please kindly move to the materials and methods.
Okay,
Thank you.
So our study design, we use the qualitative research design, and the idea for this is because we need to engage the social workers in an in-depth interviews and those that benefited from the social work interventions, which we use 30 social workers and 100 community members in a focus group discussions so that we can be able to get information about how the impact of the social work interventions in their community, and also for the social workers, the experiences they've had in implementing community and in bringing out working with vulnerable groups in Ebute Metta to see how they can be able to get good results in terms of well-being for them. So our discussions and findings basically is one of the things that was discovered from the discussions and findings is that the study demonstrated that social workers within that Ebute Metta, as in they played a vital role in terms of bringing out interventions to the community in Ebute Metta in terms of healthcare to be able to ensure that yes, people within the community they can be able to access healthcare within the community in terms of immunization, in terms of outreaches, campaigns, to be able to carry out awareness so that they can be able to embrace the healthcare infrastructure within the community. Also, education, they were able to solicit to ensure that those that could not even pay school fees so that they can be able to get educational support to pay their school fees. Economic empowerment, they had to ensure that there were contribution groups so that people could be able to save and saving schemes within the community. And also people about that had issues with abuse, child abuse, all forms of abuse. They had to intervene to be able to carry out referrals to organizations that handle abuse issues and law enforcement agencies. Some of the things they carried out was also like a community development committee group that included some of the key leaders in the community to ensure that child issues are reduced as much as possible.
If you can,
those are some of the information. Okay, sir. So these are some of the interventions they carried out to ensure that you bring out good solution to a good matter. So our recommendations here is the practice recommendations to improve community engagement so that social workers can be able to improve community engagement, training and professional development for social workers that they be able to enhance their skills, address cultural barriers, the norms and practices in that community. They should be able to address it and know how to relate with it. Our policy recommendations is to advocate for increased government support and funding, strengthen social welfare structure, and enhance professional recognition and support for social workers so that when social workers stand, they'll be able to get that respect and that acknowledgement to be able to intervene for the vulnerable groups in this community. So that's basically our recommendation. Thank you for listening, and we hope that the role of social workers in enhancing community well-being is something that we will continue to push for and ensure that by the grace of God, by the time we round up this program, we'll be good advocates of the institution in the communities. Thank you so much.
Thank you, Group 5, for that nice presentation. I'm the reviewer of Group 5. Please come on board. Sir, you have our attention.
Hello. Yes, please. Let me appreciate the presenter. I want to say that the presentations is sweet, and you guys has make me as a reviewer proud. Your presentation is okay, and even share your slide as well. I think that's okay. But let's start on the topic itself. Though I believe before now we have some, conversation with regards to your work, but I think we need to look at the topics. You said Nigeria, Ebute Metta. I think we should limit to Lagos State. Ebute Metta is in Lagos, the one I'm familiar with. I don't know which of the Ebute Metta you are referring to. And putting the word Nigeria is to me is too bogus. So let's limit that. And I think something is missing here, which I've included in your work. By the time you get your feedback, you will see that a lot of things have been improved on your work, because the purpose is to hear from your view and also to make contributions and improve on your existing works. That's what I know to be one of the role of reviewer. So I'm looking at this topic. Maybe probably if you get your work, you can also work on it. I'll probably revert back. The role of social workers in the enhancement of community well-being through advocacy. Through advocacy. If I'm to pick it up from the last presenter, your concluding remark shows what you guys are, by the time you round up your program, what you are looking forward, to do in the areas of community development, which is one of the field in social work discipline. So I put the word through advocacy, but when I look at community well-being, it encompasses a lot in terms of probably healthcare, educational, and looking at your result as well. So some of these things we definitely, link up with the issue of advocacy, because anything that has to do with community well-being, like a way a social worker can advocate for it. So, and I just put a case study. So I try to silence your areas of your work, which is a Ebute Metta in Nigeria, but a case study. Probably in the, from your abstract, which I've looked into here, you've mentioned Ebute Metta. So your reader will definitely know that this is the area that you are targeting at. Okay? And from your abstract, I think you guys have done a brilliant work so far. Yeah, I think it captures what it takes in terms of the executive summary of the work. So my moving on to the introductory part of the work, I observe, which I've made my comment and probably areas of sections for you guys to really improve on. I see that you guys make some strong, a well-structured introductions to the work, which I see to be more self-opinion
So you are just writing on your own, even though at the second paragraph you try to make reference to how social work has addressed the issue of societal problem and giving some statistical support to your writing, but there is no source for that. You didn't put the citation, the source of that, and I can see from your introduction linking to your background of the study, even to your the significance of your study. There is no. It's like a self-developed paper, self-opinion paper. There is no single reference or instant citation with regards to the work, which I think you need to even go into deeply. And my observation in terms of your problem statement, I can see it on this also. It all figures out on the self-opinion, and it all captures challenges of social workers. Challenges of social workers. It's like you are not really linking it up with your topic. Your topic is looking at the role of social worker in enhancement of the community. But all that was being discussed in your problem statement is all the challenges, lack of this, lack of access to this, lack of access to this, which has been what you have been discussing. So you need to let us know, like you explained your introduction with regards to the importance of a social work. As a social worker, they are important in their environment, their society, bringing out those statistics, bringing out those issues, and what is leading to your research with regards to community well-being that you are looking at. You've given out a very brilliant background. Then moving on to your background of the study, there must be a specific issues, that you really want to address with regards to the role that social workers are playing. Particularly, maybe there are issues experienced in a particular areas in Ebute-Metta, precisely in Lagos. And social worker, through their advocacy, their networking, they've been able to address that. How did they come about that? Then that should be what you should be focused on. Of course, this is not an academic thing, but we still believe that you should have some kind of academic touch with your work. And of course, I think you should be specific with regards to your objective. Okay? The first presenter, I'm a bit confused at the beginning of your presentations when you are talking about those variables and the rest of them. It's fine. And when I move to your methodology, I can see that you guys, even from your abstract, that your work is on qualitative research. So I want you to bear it in mind that in qualitative research, we focus deeply on dependent variables, while we silence most issues to be discussed on independent variables. Okay? So in qualitative research, your focus is your dependent variable. With this regard, we are looking at community well-being, then linking in with the role of social work. But when you are your methodology speaks of quantitative research, then you can start looking at those variables that you want to really measure or looking at. One of the objectives here was stating to investigate, to identify I can see now that from your problem statement, the objective to now capture what the problem and probably what you want to, which has deviated you from your research work. You said to identify the challenges that social workers face in fulfilling their roles. You can see now, which is fine. Then number one of your objective was talking about the interventions, meaning that with regards to the community well-being, there is an intervention or a program that social worker facilitates with regards to maybe a pending issue in these particular areas you are looking at. So with that intervention now, you want to look at how the social worker plays those roles. And probably from their wealth of experience in the field, you gather it with regards to that particular, your study areas that you are looking at. But when I look at the presentation of group 4, I can see that they are very specific when they are talking about Ibogun area in Ogun State and the rest of them. So I want you guys to streamline your objective. It's possible, I think, with this work, objective 2 is okay for your objective. And I can see that the objective is not linking with the research question. So it gets me worried, because in qualitative research, we are more concerned about our research questions. The research questions is very germane to a qualitative expert, which I'm a qualitative expert, so I'm speaking from experience. So I can see that your research question is not linking up with your objective. So that gets me worried on what you want to be discussing in your literature review. Because from your literature review, whatever you now get from your finding, we now need to now look into it to now, just oppose or probably look, maybe your research, your findings contributing to a existing body of knowledge, or probably open another space for research for us. Okay? For me, your literature review is clear, but it only link up with only one objective of your work. And that is my worry, that by the time you get feedback of your work, probably you should really work on it, revert back to me, and let's really polish it, work well, so that your work can sound well, to be published, okay? And to me, if I'm to borrow from my moderator, social worker Idina, with this kind of word that totally not acceptable. And for me, this is a kind of not really an academic paper by extension, but just this is a professional this thing. And to me, this your work is totally acceptable by the time we finish working on it. All right. Now your literature review, like I said, link only one objective of your work, which specifically on your objective 2 only. So I didn't see any link. And the theoretical perspective in terms of the theory you've been able to identify, I think that they're best in line with your work with regards to community development theory and the socio-ecological theory by Brentford. I think I've read more about that theory. It's okay. And you also point out on your global studies on social work and community well-being brilliantly. You guys did well on that. Now, let me move to your materials and method, and that's my worry. Okay? I'm aware that Ebute Metta is in Lagos, of course, mainland in Lagos, and there are local governments that constitute mainland in Lagos. So you said from what I have here, because from the first presenter, you said 30 social workers were engaged in terms of interview. But what I'm saying from your work here, you said you engaged just 20. Okay, but I didn't know how you split all those 20 in terms of, is it group focus group discussion that you used? And you also said you also interview 100 community members. So which I didn't see the feedback of those community members in your findings. So, of course, in terms of evaluation, like you said at the beginning, we need to get the feedback from the community that the social worker has engaged, or probably bring an interventions to them. So you need to look into that. And 20 social workers across each LCD. So I don't know, is it in terms of local community development areas within that jurisdictions? I think we need to be specific about your work. And of course, these are terminology used in qualitative in terms of intervening. Your interview goes for 45 minutes, 1 hour, and tape recording and this and that. But I think there are some things missing here that can query your work that truly maybe probably you guys have not really go to the fit to really do an in-depth interview for you to get to these findings. Of course, you make mention that in your analysis, you make use of Envivo software. I'm an expert in Envivo software, but I think at this work level, I didn't see anything that has to do in terms of your findings, some of the features, some of the things we get while using this software. I didn't see it in your findings at all. Okay? Ethical consideration, that's fine. And go to your findings. Your findings. Well, so far, I think your findings specifically pointed out those challenges faced by social workers. Okay, it pointed out on that, and also with regards to the impact that social workers has faced in addressing these challenges. Now, you can now see that from your work, from your topic, if you want to look at the challenges faced by social workers in their engagement in community or in their practice, that is a brilliant topic. You can easily look into that. Okay, don't deviate. There is a difference between role and challenges. Role has its own concept when it comes to research, and challenges have its own. There is nothing wrong you being specific about challenges. So if I may, like from my recommendations there, I said it's possible probably you revisit by your topic and look at challenges, experienced by social worker in their engagements in community activities or community development through their various advocacy. That would sound brilliantly, but because your result is just showing those challenges they are experiencing in the field of their engagement. All right. Coupled with other findings you have here, which is okay, but it needs to be specific. The concluding part of it, I see that you are too specific about the issue of eputemeta. Does the work only have to do with eputemeta? Is it not going to be kind of, that you can replicate these things, somewhere else, so that it won't always be for eputemeta, because the use of eputemeta in your work is too, I don't know, it's much. But of course, I love the way you guys present your recommendations with regards in terms of practice, in terms of policy recommendations, and of course, brilliantly, you also mentioned, recommendation for future research, which is good. I think people can also pick up at the end of your work. However, I think I'm much available to get this work back from you guys, so that we work on it and revert it, and probably it will get published. I think you guys have done brilliantly well. Your presentation is nice. I want to appreciate you all, and not probably your other colleagues too. I think that's fine for me. All right, all the best, please.
Thank you, sir.
Thank you, sir.
Dr. Adikalu, for that brilliant review.
Yes.
Over to other reviewers and fellow colleagues for questioning. I don't know if we have any question. All right, for the want of time, in the absence of any question, can the group leader please respond to all the gray areas pointed out by the reviewer? Hello,
Okay.
group leader.
Yes.
Group.
Yes, very well, sir. I think our reviewer mentioned a number of things. The first one is the generalizability of our work.
Just tell us what you do, please.
Okay, yeah, we are going to work on all the areas he has highlighted and make the appropriate amends and get back to him. Thank you, sir.
All right, thank you. We appreciate that. Once again, thank you, Group 5.
Thank you, sir.
Group 6, you have the floor. Your time starts now. Hello, Group 6. Can you hear me?
Yes, sir. Good morning, sir. Good morning, able and intelligent supervisor, lecturers, dedicated reviewers. My name is Mrs. Agunlejika Olaboto, and we are talking on the topic that says crisis intervention through trauma-informed care in Alimojo and Ilogo General Hospital, Lagos. And we are looking at the import of crisis intervention, trauma-informed care in dealing with crisis intervention.
the relevance of the work to social work is it is important for us to know that trauma is an inevitable part of life, and as we go through challenges that sometimes may be so overwhelming, it is needful for us as social workers to manage those situations, which can transcend into cognitive, behavioral, or emotional challenges that may impact our lives negatively. So our work as a social worker is to see how to make this, how to transcend this trauma so that the client can cope with them. Crisis is a significant event that threatens individual or communities, necessitating urgent action that can arise from various situations like natural disaster, personal emergencies, leading to emotional distress and disruption. Trauma, on the other hand, is the emotional response to such crisis, resulting in lasting psychological effects. That is, trauma can have lasting effects on the people, on the client. So as we tend to provide support and intervention in crisis through trauma-informed care, we tend to recognize a widespread impact on trauma on individual and responding with empathy and understanding. As social worker, we respond to trauma in our clients with empathy and understanding. This approach emphasizes creating a safe environment, building trust, and empowering clients to regain control over their life. This study investigates crisis intervention through a trauma-informed care in Alimosho and Ilogbo General Hospital, Lagos State. And the research study was carried out using a descriptive study survey. It's a descriptive study design. So
That's
a descriptive survey design.
Okay, that's okay. We will not be taking up the next speaker. The second speaker should speak on the materials and methods. Okay? And I will be calling on Azomta to do that. I'll be calling on Agbasi Azomta Uchenchuku. Please, your time starts now. Azomta, I want to believe.
Good morning, sir. It's like Azomta is having a technical challenge with her phone. Please, can I take up that side? Thank you, sir.
Please, who is speaking?
This is Anamneze Doris Ijoma.
Okay, please go on.
Okay. Good afternoon, our dear Dr. Vivian Alofe and other highly facilitators and my social workers. I have to talk on this.
Okay,
our topic already is on, like my fellow social worker has mentioned, is on crisis trauma intervention.
Okay, I'm here to talk about.
But now I'll talk about the materials that we use for this method. Materials and methods are used by practitioners of trauma-informed care to support and implement trauma-informed care. Principles and also provided trauma-sensitive environment for individuals who might experience trauma. These materials include, not but limited to this number, trauma-informed care workbook, assessment tools, questionnaires, trauma symptoms, and checklists. Most of these ones you can find in the hospital. And sorry, I'll move forward. And the safety plan, intervention materials, coping skill worksheet, training materials for staff and providers, self-care resources for staff and providers such as stress management techniques, burnout prevention techniques. Now, I can also talk a little on the method that we use. Methods are being employed by professionals of social work in trauma-informed care, including not but limited to trauma-informed assessment and screening. According to the Substance Abuse and Mental Health Services Administration 2020, emphasized that trauma influences individual, how individuals receive and react to their environment. This will help enhance resilience, improve coping skills, and reduce symptoms of symptoms and distress. The view of the method says individual and group therapy, which include cognitive behavior therapy, according to Marcia Christians and others, 2022, pointed out that cognitive behavior therapy is one of the most important methods of psychological treatment for depression and the adulthood under investigation. Number 3 of it talked about safety planning and the crisis intervention by a robot, 2018. Use this method to identify immediate risks, needs, and emotional and environmental stability. Family and caregiver support, Tarikon and others of 2019 investigated the impact of family support on care skills and stress management. Collaboration with other services such as advocacy, this part of social worker, identity and legal professionals, Bravery of Bridge 2017 examined the effectiveness and trauma-informed collaboration intervention between healthcare providers and caregivers. And the third slide talked about the conclusion. Or do I go ahead or leave for our third presenter, sir? Do I go ahead? Hello, sir.
Let's leave it for the next person to talk about the conclusion and recommendation, please.
Okay, thank you, sir.
All right. I'm calling on Udejinta Nora. Udejinta Nora.
All right, good. All right, good afternoon, my fellow colleagues and my reviewers. All right, I'm taking on the conclusion. Crisis intervention through trauma-informed care is key to rendering support to individuals living with trauma. Now, trauma-informed care there recognizes individual experience, prioritize safety, and assist the client to recover from such experiences. From the findings in both hospitals, it has been discovered that crisis intervention through trauma-informed care has been minimally applied to the treatment of clients due to factors such as lack of awareness, training, posting and transfers, burnout due to workload which resulted from lack of personnel. However, in some cases, clients are referred to other facilities for treatment. In conclusion, therefore, there is a minimal level of compliance of trauma-informed care in the facility under study. Recommendation. From findings from both facilities under review, we strongly recommend that adequate and intense training and education for practitioners should be adopted. 2, practitioners must use assessment tools to their disposal to determine the severity of the trauma to be able to provide necessary support for the client. The 3 aspect of it, practitioner must employ self-care in order to guide against secondary data, which is very important. The first one is the uniformity of operational structure across board in all governmental facilities in order to enhance practice and professionalism across board. And the last one talks about there should be government should recruit more practitioners in order to avoid this trauma. Thank you.
Thank you very much for that nice presentation, Group 6. And I'll be calling on your reviewer, in the person of Dr. Vivian Alofe. Please, ma'am, you have our attention.
Okay, thank you very much, the moderator. And greetings again to the facilitators, the reviewers, the participants. It's been a long one, but also very educating and inspiring. And it's an honor really to be the one to review this group work. That's Group 6. The last but not let me begin by commending members of Group 6. All through the period we were working together, a teachable spirit, a doggedness to achieve their goals, and a willingness to go over their work again and again. What we have here today, though not perfect, it's a representation of how willing they have been to make amends, learn and unlearn, and then come up with some presentable. To start with, I would like to ask members of this group to share with us what the motivation for this work is. You know, for this kind of research activity that is practice focused, the motivation is central. If the motivation isn't right, at the end of the day, we say everything that needs to be said, and nothing is going to change in the place of practice. So anyone from that group to share with us what was the motivation for this study? Because it's not in your paper.
Hello.
Go ahead, please.
Good afternoon, ma. Hello, can I speak on, ma?
Go ahead, please.
Mrs. Ola, please can I talk? Hello, good afternoon, everyone. My name is Tina Egesi. I'm a member of Group 6. Please, can I continue?
Please go ahead. Thank you.
Okay. My name is Tina Egesi once more. I'm a member of Group 6. Ma, thank you very much for your review. My motivation, or our motivation, I want to speak on behalf of the group. You asked about what our motivation has been, you know. Personally, this topic really struck me. For the past 9 months, I have been going through this crisis intervention. My husband personally has been down with stroke since December. As a social worker, it's been being a member of this group has really helped me to, to cope or to, show a lot of, because as we are told, social workers, we have to show empathy, care for people, that are going through crisis. So being a member of this group have personally helped me to give him the support, because he's not even here in the country with me, and he's in the United States, and he's been down with stroke for the past 9 months. So being a member of this group and as an aspiring social worker, the knowledge I have acquired so far has been helpful to me, in encouraging him, giving him emotional support, and showing empathy in his recovery. So personally, I'm excited to be among this group, and this topic really strikes me. And I know that since stroke is not something that one recovers immediately, it's been gradual because it has affected his speech and so many other things. I'm sure that with this knowledge that I've acquired as a member of this group, it will go a long way in helping me help him also to cope with this present crisis that we're facing as an individual and as a family. Thank you very much.
Okay, thank you. That's a good one. At least to know that whatever we have put together in theory can be applicable in practice makes the whole effort worthwhile. Although you've spoken from a personal angle, it is still relevant. I was expecting that the response will be tailored along the lines of the motivation to make a difference.
Ma, can I make contribution, ma?
Is it the same person?
No, not at all, ma.
Okay, 1 minute, please.
All right, ma. because of the prevalence of trauma in the human.
Please mute your mic.
We
Only
need
mute your mic. The hosts, can you please help us check for muted mics? Thank you. Go ahead, please.
looking at the fact that by the time someone has crisis, he or she approaches the hospital for treatment. So the emphasis of the interest of this work is to see that the practitioner, the professionals that we handle these cases, are they informed? Are they trained? Are they really aware? Do they really know how to go about it? And that is the reason we are focusing on it. That if the professionals that's supposed to handle it are well equipped, then it will be handled. It will be better handled. The cases will be better handled by the professionals because they would have been trained. They would have known the instruments to use. They would have been able to know how to apply it and how to solve these problems. Thank you, ma'am.
Okay, thank you very much. That is a more relevant response. So I think the group is on the right track, knowing why they are doing what they are doing. And this is important because, in this part of the world, we are still trying to put our acts together when it comes to identifying what trauma really is. We tend to downplay the amount of suffering individuals go through when they experience one traumatic event or the other. So this is a very important, a very germane aspect of social work to look at, especially for those of us in this part of the world. We need to bring up more awareness, more education when it relates to trauma, so that we won't find ourselves being hampered by our cultural orientations or religious beliefs and things like that. Okay, so now to the body of the work, the main paper submitted. The work itself is interesting to me because it is practice-oriented. At first, the group started off by being overly academic, being overly abstract, and that isn't going, not in this particular forum. But what we have right now is more tailored towards practice, from the title all the way down to the recommendation. That seemed to be the borders within which you carried out this research. And for me, that's a very good one. The introduction is succinct. It is not too elaborate. And for me, that is good. An introduction shouldn't take up the whole of the work. But then it would have been better if you wrapped up that introduction by connecting it to the current study. When you started your introduction, normally you spoke about what has been the concepts and all of that. So you shouldn't leave off that introduction without connecting it to the concern of the day. Otherwise, it will just appear like a paragraph from a textbook without any connection to what you are doing. So you have to go back to the end of that introduction to mention how everything you have said relates to what you are about to present. The same thing goes for the statement of the problem. It is logical. Your statement of the problem is logical, but there is no concern expressed for the state of things in your area of study. From the point of the statement of problem, you should convince us that you are aware, at least you have an idea of what is going on. You must have had some interaction, some interface with that location, with that population, before you can decide to even want to study something about it. So to do a statement of the problem without even mentioning anything about your area of that capture, that area you want to capture in your research, is kind of counterproductive. It's poking a huge gap into what you have done. Then you need to. Is anyone speaking? Please help us mute Abayomi. Your mic shouldn't be unmuted now. Abayomi, please mute your mic. Okay, so I was talking about the research question. They are relevant. Your questions are relevant, but you need to check the third one. Something is missing. I'm sure I saw the complete thing, but in what you sent afterwards, that third research question is incomplete. Please make it up. Then the significance is relevant. I was particularly impressed by your reference to wanting to bridge the gap between theory and practice, because we know all of these theories about crisis, trauma, crisis intervention, they are in the books. But how are we going to bring them to the practice room, to the consultation room, so that clients can benefit maximally from what we know or what we are supposed to know? So for me, that's a strong one. Showing interest in wanting to bridge the gap between theory and practice is commendable. Your literature review is also relevant. Like I said before, you seem to have your mind focused on practice. So there's a lot of emphasis on trauma-informed care in your literature review. You gave us enough details on the core principles of trauma-informed care. You talked about the integration of trauma-informed care in crisis intervention. You gave us even guidelines for trauma-informed approach to intervention. I think that is a good one. If we have all members of this group internalize these things and take them into the place of practice, I have no doubt that it will push social work practice beyond the horizon or beyond the borders we have right now. My concern, however, in that literature review is the fact that you have 2 theories and 5 models. Rosemary, you need to unmute. You need to mute yourself. Rosemary or the host, please mute Rosemary and Kanaka. Somebody should mute that mic. Thank you. So I was saying that within this short space, this limit of the paper you are to present for this short course, you have 2 solid theories and 5 solid models. For me, that is throwing your net too wide. You wouldn't be able to tell what you would drag in at the end of the day. And interestingly, you did not mention which of these theories or which of these models your work will align with. It has been mentioned here today that it is not enough for you to just throw theories into your paper like condiments when you are making a meal. You have a theory for a reason. You are presenting a theory for a reason. You are presenting a model for a reason. And even if you wanted to explore by discussing broadly around the theories and the models, at the end of the day, you should let us see which of these you are adopting. And I think for a paper of this nature, a single model would be enough for you to have a clear perspective of what you are going out there to check for, what you expect TIC to look like when it is practiced in alignment with this model or that theory. For the materials and methods, it's interesting to see that what you have looks like an extension of your literature review. At least that is what is in the paper you submitted to me. I was relieved, however, when I listened to your presentation and I heard that you are doing a descriptive survey, which is actually relevant to your topic, which is relevant to the method for gathering data that you presented in your work, which is a structured interview. So the choice of a descriptive survey is all right, but I can't find it anywhere in the paper I have. What you have under materials and method is maybe an extension of the principles or the rudiments of TIC. So please go back to that materials and methods and clarify what methods, what kind of research you want to do, what methods are you using for gathering data and all of that. Are there other materials that are relevant to your investigation? Mention them under materials and methods. I know that you did the structured interview thing for gathering your data, but I didn't get anything from you in relation to the questions or the transcript of the responses you got. The coordinator said something very important earlier on, that you should, as practitioners who want to go out there to do something that will show that you know your onions, you should be excited about carrying out this research yourself. You should be excited about going to these hospitals you mentioned to interact with the social workers there. So I need evidence that you did that. I don't want to believe you didn't go there, because it will be so painful, because you have missed a whole lot in what you are supposed to get to equip you for practice. So you need to let me see your structured questions. Let me see the transcript of your interview. And that is when I will be able to conclude with you. I will be able to endorse your findings, and I will be able to stand with you in your conclusion. So look into that and see how that can be rectified. So for the findings I have, I discovered that early on in the findings, you veered off into focusing on rape cases. Are you saying rape is the only trauma that can take people to the health facility where the help of social workers can now be enlisted? I wasn't quite satisfied with that. We have a wide range of cases, situations that can be traumatic, that social workers can provide intervention for. So please look at that and see how it can be presented accurately. And then your findings are too general, because I can't see any specifics relating to maybe number of trauma cases treated at the social work clinic in the health facilities. There is nothing specific about your rating of the frequency of the application of TIC. Because that's what you are going there to look for. We already know that they handle trauma cases, but are they consciously making use of TIC in intervention? So you should be able to give us something, even if it's a simple percentage of something like out of 10, only 2 out of 10 cases show evidence of the application of TIC, which is 20% of cases, something like that will make your report more credible. It wouldn't look like something you just wrote from the top of your head. It will give it that touch of professionalism. So we need something more specific from you. We don't know at this moment how frequent the application of TIC is. And that is one thing you stated clearly in your research question. You want to know how frequently TIC is applied in crisis or trauma intervention in those places. So please go back to your research questions. Your research questions are not there for decoration. When you are putting together your findings, keep an eye on the research questions and see that you report on each of them. If you don't report on each of your research questions, your research is not complete. Okay, I think I'm winding down now. What else do I want? Okay, the recommendations. The recommendations. I need you to go back to your abstracts to see that what you have there is in line with what you have in the body of your work, because I can see something about government doing something that I don't quite get. Let me see if I can just move up to your abstract and then read it out to you. I think it's in the last paragraph. It says, therefore, the government should promote trauma-informed practices. You know, for me, that's kind of funny, because if we rely on government to be the ones to promote trauma-informed practices, then we'll be waiting a long time. So it is up to to practitioners first, social work practitioners, social work regulating bodies, policy-making bodies, to first of all put forward the need to adopt some of these practices in crisis intervention. It is by liaising with government bodies that we can now have maybe legislations or things like that. But practitioners and social work bodies should be the ones to first of all promote this practices. We can't jump all of these stages to drop this responsibility on the table of the government. So I brought it up because it's there in your abstract, but in the recommendations in the body of the work, there's nothing like that. So you need to look at it and then do a kind of synthesis so that what you have in the abstract would be in line with what you have in the body of your work. So every other thing in the recommendation is reasonable, logical. And I'll wrap up by saying, if you move on, like I said earlier, into practice with this understanding, with this orientation, your services will be widely sought and you will definitely stand out. And this goes out also to every other social worker who might be involved in care, in trauma care at one point or the other. So thank you for what you have brought to enlighten us further on this. Thank you for the effort you have put into the work.
Thank you.
Thank you so much, ma'am.
Thank you, Dr. Alofe,
Thank you, ma'am,
for that insightful review. We appreciate that, ma'am. Any question for Group 6 members? Okay, can the group leader of Group 6 briefly react to some of the issues raised on what you and your group members are willing to do?
Thank you, sir.
Group 6 leader. Yeah.
Thank you very much, sir. And I want to appreciate the observations of our group, of our reviewer, Dr. Alofe. Thanks for your support and your guidance all through. Talking about the models, we related.
No. Just tell us what you will do. Just tell us what you do.
We will go back and we will do according to what she has said. We are going to review all the things that has been pointed out to us. We are going to sit and see how we are going to translate those aspects into practice.
Thank you very much. And if you do that, this work will come out better than the way it is. We appreciate your wonderful presentation and all efforts by group members to make sure you come up with something of this nature. We will now be going back to one of the groups.
Thank our
reviewer, sir. Personally.
We'll
Thank
now
you,
be
ma.
going back to the group we missed, which is group number 3. And like I said earlier, the reviewer is unavoidably absent. However, it's quite unfortunate that I don't have your cover page to even know the group members, but I have your slide anyway. So let me call on group 3 members, and your leader should start the conversation or the presentation, and your time starts now. Group 3.
Okay. Greetings, the moderator, the coordinator, facilitators, and the reviewers. Our topic is the impacts of electronic gadgets and social networks on academic performance. A case study of
Sorry for cutting in, please. I understand you have a slide for this presentation. How come you're not projecting it?
Sorry, sir, I can't project all these other slides currently on. That's why I'm waiting for this person to start.
Please do the needful. Group 6, please take down your screen. Group 6, take down your projection, please, for group 3 members to project their screen or share their screen. All right, you can continue.
Okay, sir. Thank you, sir. Our topic is the impact of electronic gadgets and social networks on academic performance, a case study of public secondary schools in Enugu State. This study investigates the impact of electronic gadgets and social networks on the academic performance of public secondary schools in Enugu State. With the proliferation of smartphones, tablets, and laptops, along with widespread access to social network platforms like Facebook, Instagram, posed to both the educational
Please, someone from group 3 should take over. Like I said, I don't have your cover page, so I don't even know the group members. Someone from group 3 should take over. It's like the first presenter is off. Hello.
Hello. Hello.
Are you a group 3 member? Top air.
Yes, I'm a group 3. Yes.
Yes,
continue.
sir. My network went.
Okay.
Hello. My network went off, sir. Sorry about that. So the study employs a secondary data analysis approach to explore patterns of gadgets and social network usage and their effects on students' academic outcomes. So this findings reveal that excessive use of social networks and multitasking with electronic devices during study times lead to cognitive overload, diminished attention spans, and declining academic performance. However, when used appropriately, these technologies can facilitate collaborative learning and access to educational resources. The study emphasizes the need for educational policies that encourage the responsible use of electronic gadgets and social networks, balancing their benefits with potential risk to students' academic sources. So because we use Enugu State proliferations of electronic gadgets and social networks among secondary school students has mirrored global trends. With increasing accessibility of smartphones, laptops, and affordable internet services, students in public secondary schools have unprecedented access to digital platforms for communication, learning, and entertainment. WhatsApp, Instagram, and TikTok influence the daily routines of secondary school students in Enugu State, consuming a substantial portion of their time in this trend is evident in Enugu State, where many students engage in social networking activities during school hours and social and study time, often at the expense of their academic obligations. Therefore, understanding how electronic gadgets and social networks influence students' academic experiences in Enugu State crucial for addressing this. It is crucial for addressing these challenges. Despite these efforts, there is still a need for a more comprehensive understanding of how electronic gadgets and social networks affect student academics achievements in this context. This understanding will inform the development of effective intervention and policies aimed at maximizing the benefits of technology for educational purposes while minimizing its
Next person,
thank you, sir.
Take over and discuss on materials and method. Please, the next speaker should discuss on materials and method.
Hello, sir. Hello. Hello.
Please
Hello,
go
sir.
on. We can hear you.
Okay.
I can hear you. Introduce yourself and.
Okay, my name is Mr. Subara Bayomi Mutil. I want to add more to the first speaker, my group leader, Ms. Sineye. So the material and the method. This study employed a secondary data analysis approach to investigate the impact of electronic gadgets and social network on the academic performance of public secondary school students in Enugu State. The secondary data was selected as the primary method for this research because it provides a broad perspective on the issue by synthesizing findings from various studies, survey, and reports. The secondary data for this study was sourced from academic journals, research articles, government and educational reports, and statistical database. The data collection process involved a systematic review of existing literature and reports to ensure the inclusion of high quality and relevant sources. The study focused on peer-reviewed journals, reputable publication, and official reports. Such keywords included electronic gadgets, social networks, academic performance, secondary school students, and Enugu State. The data analysis of the collected secondary data was conducted through a thematic approach, and a comparative analysis was performed to evaluate the findings from different contexts, including studies conducted outside Enugu State. So that proceeds from the discussion of findings. This analysis of secondary data in this study revealed a concerning trend. Students in public secondary school in Enugu State who spend excessive time on social networks often exhibit a decline in academic performance. The study finds that excessive engagement with these platforms competes with time that could otherwise be allocated to academic activities. Multitasking with electronic devices during study time has also emerged as a significant factor contributing to the decline in academic performance among students. In Enugu State, influence of social network of students' academic behaviors and attitudes. Social networks serve as platforms to peer interaction, and students are often influenced by the behavior and attitudes of their peer online. The finding also highlights electronic gadgets' role as facilitators and hindrances to learning. While gadgets like smartphones and tablets can provide access to educational resources, their misuse for non-academic purposes can lead, sir, can lead to a decline in academic performance. Hello, sir. Hello?
The next person should take over from there and talk on the conclusions and recommendations.
Okay, good afternoon, everyone. My name is Maxine Botidem. I'm a member of the group CORE. So I'll take on the conclusion of the work that we did. So just like my whole program had mentioned, he has talked about our data source, the analysis, and we did. So the conclusion of our work states the impact of electronic gadgets and social network on academic performance is very profound. While these technology tools provide access to vast educational resources, it facilitates communication and offer collaborative learning opportunities. Also, across several studies, including that of Uduka, emphasizes that electronic gadgets during study time experience a notable decline in academic outcome. And also, in conclusion, while electronic gadgets and other social networking can serve as a powerful educational tools, we have come to know that they can also, it depends on how much likely these are like. So therefore, educational policies and interventions must strive to find a balance between promoting responsible and purposeful use of these technologies, while emphasizing on their potentials to enhance learning rather than distract from it. So our recommendations from our work simply state that the first one, we want to talk about the implementation of school policies limiting social network use during school hours. So we've come to know that schools in Enugu we recommend that schools in Enugu should implement clear policies that regulate the use of social network during school hours. And this will cause restricted use of social medias during schools that can lead to distraction and reduce academic focus. We also recommend that schools can create a more conducive learning environment by enforcing rules that limit access to social media during instructional time. So the next bullet point on our recommendation, integration of educational use of social network. So we recommend that while excessive and non-academic use of social network can be detrimental, we also know that these platforms also serve as a potential to enhance learning when used appropriately. So we recommend that teachers should be encouraged to integrate the educational use of social network into their teaching. Teachers can also leverage these platforms to engage students in academic discussions, share supplementary learning materials, and provide assignment feedback. Example, so we can even, teachers can use private classrooms, groups or platform on Facebook or WhatsApp, just like we do for our classes on the FIPE classes. So we can also encourage teachers to use these platforms to teach students and also inculcate learning. So the third one, we want to talk about guidance on time management and responsible use of electronic gadgets. So parents and educators, they have an important role to play in shaping students' attitude towards this use of technology. So one of the key findings in our studies revealed that poor time management and lack of self-discipline contributes to declining academic performance among students who misuse electronic gadgets and network. So we recommend that teachers should set boundaries for social media use while allocating specific times for checking social medias and prioritizing academic tasks. We also recommend that workshops and training should be organized to educate students about the potential risk of excessive social media use and the importance of balancing leisure activities with academic responsibility. The fourth recommendation we have from our work is digital literacy and media education programs. So we recommend that schools should incorporate digital literacy and media education programs. These programs will help to educate students about the responsible use of technology while also highlighting the risks associated with excessive use of the media. So through these programs, teachers should also be impacted about multitasking on cognitive functions and academic performance. Educators can also be equipped during these programs with the knowledge and skills needed to make informed decisions about their technology use. Additionally, these programs can cover topics such as online safety, privacy. We know that a lot of information which are not protected. So through these programs, we are recommending that some of the topics to be covered during this program should be online safety, the importance of verifying information to combat the spread of misinformation, a well-rounded digital literacy program that can empower students to navigate the digital world responsibly and use electronic gadgets and social media to enhance their learning experience. So the last on our recommendation is collaborative efforts between schools, parents, and the communities. We know that these three bodies or groups, the school, the parents, and the community, they have an important role to play. So we are recommending that they address the impact of electronic gadgets and social media on academic performance, which requires a collaborative approach. So schools should engage with parents through regular communications and workshops to keep them informed about policies and practices with technology use. And in turn, we also recommend that parents should actively participate in their children's education by monitoring their technology use and providing support for academic activities. Thirdly, we also recommend that communities organizations can also play an important role by offering resources and programs that promote healthy digital habits. So by fostering a supportive network, students can receive constant guidance and enforcement on the responsible use of electronic gadgets and social network at school. So we think that if all the bodies, the relevant stakeholders, the relevant bodies come together to implement some of these recommendations we have shared, I think students, not only in Enugu State, can have a better educational performance, even with the use of electronic gadgets and social networking. Thank you very much.
All right, thank you to all the presenters. Thank you to group 3 for being patient, and also thank you for this wonderful presentation. I would like to repeat that it's quite unfortunate that I don't have your seminar with me here, and I don't even have names of the group members. However, I will make do with the slides that I have here. I was just considering your topic, and one of the things that captured my interest is the fact that you were able to limit yourself to a particular area, which is Enugu State. And before embarking on this research, I believe you must have envisaged a problem. You must have had a first-hand information about this challenge that you want to address. So there are schools, secondary schools within Enugu, probably within the Enugu metropolis, you would have approached to say, okay, fine, let's make do with your, will I say, your results, student results, to try to see why some students are not performing better as they used to do. And in the course of interviewing, in the course of gathering responses, or even getting information from the teachers themselves, and if possible, meet the children, the students' parents or the people's parents at PTA level to see their access, to ascertain their access of electronic gadgets, and if that might likely be the reason why they are not doing better academically. You know, earlier on we're emphasizing on the points that, or the fact that you are, to some extent, social work desk officers. And we want to believe that most of these topics you came up with are as a result of your field experience or your experience in the job. So this information might not be far-fetched from you. They are within your disposal. So I'm just concerned about you leveraging heavily on the internet source, which is not a bad idea. But based on your topic, I was thinking you would have at least gathered some information that are already available, namely the student results, and try to ascertain why some students are no longer doing better as they used to do. Then relate it with the topic, if it's because of their access to social media or electronic gadgets. Well, your recommendation are also in line with your topic, which is fine. But I always have problems. You see, one thing in social work is one thing that sets social works apart from other professions is our interest in solving a problem.
We can't hear you, sir. We can't hear you any longer, sir.
Can do. The government should do that. Who are the government? What is advising the government or policymakers to make laws and policies that have human faces and help to correct some abnormalities in some institution, or even help to correct some policies that, because of some of its clauses, it has failed to reach the grassroots or to serve the purpose for which those policies were set up in place. But by the time you begin to say the government should do this, the government should do that, you're making your work more theoretical, more bookish than practical. And mind you, what we are interested in here is what social workers can do practically to resolve that situation. So in all, while you were able to let your readers understand that this is a problem, but you failed in that regard to let us know what social workers can do. In fact, all through your slides, I was barely struggling to see how you can come up with the concept of what social workers can do. And here you are, coming to get a certification in social work, a license in social work. And yet, you're not telling, you have the opportunity to tell us that, okay, fine, this is what my knowledge of social work has helped me to identify. And this is what I think, in my own opinion, and based on research, that the social workers can do, or social workers are better positioned to do. Well, the fact that your reviewer is not on ground it does not mean she has not done anything. So the information reaching me now is that she's with your work and she has made a lot of adjustment or recommendations, reviews for that work. So after this presentation, you do way to meet her or contact her to see how she can give you the corrections she has made already, so that you can effect those corrections and put this work in a better shape than the way it is now. Without much ado, I want to leave the floor open to questioning. I don't know if we have questions from participants, questions from our reviewers, and questions from facilitators. Is there any question? All right. In the absence of any question, once again, I want to thank all participants for making the necessary sacrifice to be here. It is worth it. In fact, it has been a long period, hours of deliberation, discussions, as we were able to peer into your presentation, your seminar presentation, to figure out areas in which you need to make the necessary adjustments. It will also interest you to know that these presentations gave us opportunity to also know the stops you are made of, and want to use the opportunity to say, well done. But no matter how good or no matter how better you are, there is always room for improvement. And it is on this note we are saying that, please, it is better you make improvement than to regress, right? I also want to use the opportunity to thank and appreciate my colleague, especially for some who have been consistent from the beginning. In fact, some of us have been here since the beginning down to this end. While some engagement had to take some of us out, we appreciate all your effort. We appreciate for making out that time and making the needed sacrifice to be here to allow the upcoming generation of social workers, researchers, professionals to benefit from your wealth of experience. And permit me to say, God bless you, sir and madams. So, without wasting much time, I can see a hand up. Is it Fasholade Akinleye? It's like you want to say something. Kindly unmute your mic and speak.
Okay. Good afternoon, sir.
And
Good
thank you so
afternoon.
much, sir, for what you've been doing for us. We really appreciate it, sir. And all our thanks to all the facilitators and our reviewers, sir. Please, I just want to call your attention to something. I belong to Group 1. I'm a member of Group 1. I joined, but the network was bad when you called the attendance. So I couldn't mix up with taking the attendance then. But I was fortunate to meet up with the presentation and everything. Sir, please, can you just give us the opportunity again to take our names again so that we can actually mark
Just drop your names.
our
Drop your
presence?
names on the chat section. Okay, I'll pick it up from there. Drop your names there.
Okay, sir. Thank you so much, sir.
All right. I can see the hand of Adeyemi C. Sarumi. Please, if your question is in line with what the first speaker just said, no need to re-emphasize or re-echo it. Just do the needful, okay? Abayomi, you want to say something? Your mic is
Yes,
unmuted.
yes, sir. Yes, sir. I just want
Hello,
to ask
sir.
a question
Okay,
about how do you want to do the attendance for we in Group 3, sir?
I just said something. I said if your question or your concern is about on attendance, please go to the
Okay,
chat
sir.
section
Okay,
and
sir. Okay,
drop
sir.
your names.
No problem.
Olamide, you want to say something?
Sir. Yes, sir. Good afternoon, sir.
Quick one, please.
Thank you. Yes, sir. Thank you for your input, sir. Sir, it's about the exam that will be coming up next week, sir. I don't know whether
Okay.
you have information. I don't know whether you have information for us or how to go about it, sir, because I know it's going to be online. So I don't know.
Okay.
Maybe there's anything you need to tell us about. Thank you, sir.
Is it in terms of the time of the exams or the format it will take?
Yes, sir. The
If
format,
it's
sir.
like you say, if it's the timing, it's next week, and like the format, it has to be online. It will be online, right? Okay. I wouldn't want us to take much of our time, especially that of my senior colleague here in the person of Dr. Loretta. Please, ma'am, kindly unmute your mic and talk to us, please. Dr. Loretta. I don't know if you want to have one or two words with us before leaving. Okay. Okay. In the absence of any further comments, we once again thank the participants. Oh, hello, ma. Thank you. We can hear you, ma.
Okay. Thank you so much, Dr. Mbina Eta, for your coordination. We actually tried to manage the time. Thank you so much for what you just, took us through. And I also want to thank my fellow reviewers who actually, pointed at so many mistakes the students made and things that they were not able to put down. I had to stay from the beginning to the end, even though I had the first, time. But knowledge is, nobody is the repository of all knowledge. We learn from each other. So I had to stay back to hear from everyone. And I think I gained something. I enjoyed the whole thing. Actually nice. For the students, I thank you for being present. For those of you that felt that this exercise was worth doing, you tried to be here. Thank you for that. I will advise that you put all those corrections, make those corrections because they're very, very important. All the observations were very right. And there were some observations that were made by different reviewers, which not all of us individually pointed out. So I advise the students that whatever thing that was pointed out, like for Group 1, whatever thing that was pointed out in Group 2 or 3 that you didn't have or you made that mistake, also know that is applicable to you. So whatever contribution any reviewer made is applicable to every group from 1 to 6, like in the aspect of citing old, obsolete works of people is really not good. So go back to your literature reviews and check if it's journal article, it shouldn't be anything more than 5 years. And if it is a textbook, it shouldn't be anything more than 10 years. So for you to have 1980 something, 1970 something, it's just not good. Remove it, because it's something that will be published in our social work journals. And this journal is something that will get to everybody, both within the country and outside the country. And so if they should pick up our journals and begin to see very old, citations, it will make the individual not to even have interest in reading the journal. So do the needful place so that we'll come up with a very good work. I will also thank Katere in absentia. He's not with us. He appeared and also went out again. I believe something must have actually tied him down. Thank you, Ebina, for telling me that we are thanking him for the good work he's been doing with this professional training. And I believe that the students they've really been learning. And I also agree that they will put all they have learned into practice just to see that our profession, grows. Thank you very much. Thank you, my fellow reviewers. May God continue to see us through in this our profession, make us to be known by people and allow us to practice. And then the government making every effort to see that social work department is created in schools, created in hospitals, communities, everywhere we practice, so that the whole lot of us that have this social work knowledge will be able to practice wherever we will find ourselves. Thank you so much, and may God bless us all in Jesus' name. Amen.
Amen. Thank you very much, Dr. Loretta, for those kind words of encouragement. We also thank you for being available to share with us your wealth of experience as far as the social work profession is concerned. A quick one too, please. The purpose for this seminar presentation was not to run anybody down. Even in the process, we your reviewers too were able to gather one or two. So take whatever instruction or corrections you've been given seriously, learn from it, and effect those corrections. Okay? I want to appreciate all of you once more. And a quick one, I don't know if someone from the audience, the participants, can quickly give us a vote of thanks so that we can just wrap it up from here. If you don't mind, can Kingsley Igbenuba give us a vote of thanks? Your mic is unmuted.
Okay. Once again, good afternoon, dear moderators, reviewers. Well, I want to thank you all, sir, and madam, for this excellent piece of work. I would like to say today I have learned so much as regards social work, and also I'm sure all of us would agree that the different topics are very thought-provoking. So in saying that, like you said, sir, as a social worker, we must accept criticism, positive criticism. It's not to disempower us, but it's to continue to allow us grab the profession and develop our skills properly. So on behalf of all my professional colleagues, I'm going to say a big thank you to all our reviewers, moderators, facilitators. And like you said, the different reviewers made comments about different groups. And I think I have been taking notes, and I'm sure my colleagues have been doing that as well, so that whatever we are resubmitting, it shows that it's very reflective of what we've been told to do. And once again, it's not easy to get a second chance, and I think you've all given us a second chance. Thank you so much, sir. May the good Lord continue to bless you all in your different areas you are in the country. God bless you, and thank you.
thank you once more, and success in your forthcoming exam. A quick one, the coordinator is here with us. He just breezed in. Please, Dr. Tera, we're almost rounding up. Can you please have a word with us?
Okay, thank you very much, social worker Mbinaita, for that beautiful work done. And thank you so much, all our reviewers. Thank you, Dr. Social Worker Loretta from Rivers State University. We appreciate your wealth of experience shared with us in reviewing the paper. And thank you so much, Dr. Vivian Alofe from the Federal University of Allied Health Sciences. We appreciate you so much for the review and the comments made. Thank you so much, Social Worker Dr. Adejumo, the Federal HOD, Social Work Department of Federal University of Allied Health Sciences. Thank you so much for the good work you are doing with us and what you have said. I believe the students will, the candidates will go back and do more work so that their work can be publishable work. I know when they call you for their work to be published, you will not turn them down because they also are your products. Thank you so much. We appreciate you. Thank you, social worker Dr. Adekalu Samuel. We appreciate you also from Federal University of Allied Health Sciences. Thank you so much. And thank you, all our candidates. We appreciate you so much for all your efforts, all your labor that you have put into bringing up these papers for us to look at. Like social worker Mbina said, it's not to run anybody down. Seminar presentation is for us to sharpen ourselves, not just the candidates, but also the reviewers and the facilitators in the program, so that we also could learn one or two things from those who are presenting. The few time I've spent with you, I've actually also learned some things that came to fore from what I heard said by the students and the comments the reviewers have made. For group 3, whose reviewer was not present, at least since yesterday, she had been able to also take permission that she may likely not be there. And I'm very sure that she must still be in that meeting up till now. Dr. Kemi Otun, who is the pro-tem registrar of the institute. We thank you so much. I just also to say that it's just the beginning of the profession for many of us and many of the candidates that are coming, even though we may have been working on social work desk, but this is the process we pass through to make those who are qualified to be included in the register of the institute and the register of the cadre that each one belongs to. I believe those who are here in this final professional examination belongs to the social work officer's cadre. And by the time you finish this program and you are inducted and consequently get your license, you'll be full practitioner that can say it all over the world that you are a practitioner of social work in Nigeria. When anybody is asking you, you will be bold to say, yes, I didn't just have the certificate in school, but I've passed through the professional examination that the professional body have put up for anybody who wants to practice social work in Nigeria. And we want to believe that each one of you will also doing this. We have not started implementation of having to go through into ministries, department or agency or development partners to begin to ask for resource or the licenses. So this is an opportunity for you to also encourage others to fall in before that implementation will begin. I want to congratulate for thus far you have guys too. I have actually enjoyed being with you and the way you have comported yourself as well. Comportment of professionals. Doctors, thank you so much for what you have done. And I want to say that next week, Saturday, will be the examination. Now you have gone through the 4 courses, the 4 modules. This is the last module that is completely dependent on your and not just as individual as you have handled yours. I commend you for that. Commend you for the presentation and all. And we'll see on Saturday. Revisions. I wish what you have been taught that have been discussed can re-listen to them via the recordings and your lecture notes as well. And then by Saturday, we'll be meeting to the examination for this paper, seminar presentation. There's no exam for that. The reviewer are going to be sending to us their assessment of the group, and members of each group will do a presentation. But if you score 50 and above, it means the group have passed. Everybody in that group have also passed. So we expect from our reviewers to also send to us the results, the result sheets that we have sent to them. We also sent a copy to the platform, which is available for students to also see what we are scoring you on. So you could judge even by yourself whether you have done well or you have not done well. But I believe everybody have done very well, so that we don't heighten the breadth of some people. We believe that you've actually done well, honestly. So Saturday, we'll meet for your exam. Will be sending us test questions for you to familiarize yourself with the exam platform. It's a simple platform that you will not have problem in using. But then there's a demo. That will send also to the platform. You're going to send it so that please also remember your exam numbers when you are inside. Number in your exam, and I sort of
We can't hear you, sir. Network is breaking.
So I wish you success in your forthcoming examination.
I didn't hear what you said about the exam. The network was very bad. Couldn't hear anything.
Yeah, I noticed also that the network cut me off. Okay, I was saying that a demo will be released anywhere from now for you to be able to get familiarized with the exam portal, and that you should also remember your exam numbers, so that I don't put somebody else's number on your exam paper. So for those who have not finished paying their workshop and exam fee, let them also do that before Saturday. We pray that Eledumare will continue to bless each and every one of us to ensure that we perform our obligations during this period. Also, we want to wish each and every one of us a success in our examination. And after you have done your examination, those
Sorry, sir. Sir, please, who are those qualified
those who
to take
passed,
the exam?
then we'll be inviting them for induction ceremony. National
So the network is fluctuating. We didn't hear those things you said later. The later information you passed across, sir.
I was saying that those who have not finished paying for their workshop and exam should do so. And I was saying that after exam on Saturday and results are released, then those who pass will be invited for induction at the 15th in details will be in the letters that will be circulated for those who passed. And those who may fail one course or the other, there will be opportunity for them to resit. And receipting is at a cost. So thank you so much. Remain
How much
blessed.
is it, sir?
You said?
How much
Planning
is
to
it?
pay? Are you planning to pay? Why are you asking how much? Are you planning to pay?
No,
What is that?
we said that at the beginning of the program. If you fail, your receipt is 5,000 naira.
You don't need to pay now.
So, but I pray nobody will fail.
Sir,
So,
sorry,
sir,
please.
if you fail,
Who
that
are
means
those
you will not go
qualified
for
to write the
induction.
exam?
No, before
People that have not paid for the workshop, will they not write the exam?
Once result is out and result are released,
Will not fail.
once results are released, those who fail will be given 2 or 3 days, just 2 or 3 days for them to prepare. Then they rerun.
Okay, sir. Please,
Okay,
those
that
that have not
means
paid
you
for the
must
workshop, will
pass
they
it
not
before
take
you
the
go for
exam?
induction.
They will now. If they do the receipt, they pass, then they will be inducted.
Nobody failed to
Okay.
Sir, please, so those that have not paid for the workshop, will they not take the exam?
They will not take the exam. Oh.
Those that have not paid for the workshop,
That's what I'm saying now. Why
if
will
you've
you
not
write it
paid
down when
that,
you have not paid? We give everybody
no,
the
I'm
grace
talking
to even
of the
attend
60,000 for the workshop.
You
Those
said?
that have not paid, will you not take the exam? The 60,000 naira.
It's not 60,000 for them, it's 80,000 now.
And the exam we've paid. I'm just asking for the workshop now. People that have not paid
That's what
that
I'm saying.
60,000.
This
will you not
workshop we
take?
have just finished now. The workshop we have finished. You know, we have got paper. That's the workshop.
Okay. I was thinking it's the
This
one at
workshop and exam.
And it
What you
was
have
for
been doing,
5,000. And it was for 5,000 naira also.
what you have been doing for the past 1 month is the workshop.
Okay.
And that workshop is ending today.
Okay.
Exam is next week Saturday.
They make it in.
So
Okay,
it's
so I think
workshop and
mixing up this workshop and conference together. So I think that's what the person.
I'm not talking about conference. You are not at the level of the conference. Is a different matter. That's your
Hello,
exam. You
Dr.
receive a
Tere.
letter
The
inviting
students.
you.
Hello, Dr. Tere.
Yes, please.
Yes. I will also encourage the students to quickly do their corrections and send on time to
Okay,
enable
ma.
us
Yes.
complete the score sheet and send the result, because it will not be good for us to just send the score sheet without their correction. So we will also need to see their final work to enable us, score the sheet and send. Or are we sending just what we've done today?
No.
Okay, yeah. That's true, ma. Do their correction between now and Tuesday.
It's okay.
Please,
Thank you.
between now and Tuesday, get your correction done and resend back to
Doctor,
your
please, I want to find out, for those that have paid, how do we get our receipts?
Thank you, social worker. Social.
Hello, sir.
So maybe some of these questions can be on the group so that he can answer because of the network, I guess so.
Okay.
We can direct our questions to him on that platform, okay? Let's go.
Okay.
Thank you. So, take care and enjoy the rest of your day. Success in your exams. Bye.
Thank
Yeah.
you.
Okay.
Thank you so much, sir.
Alice, we appreciate you.
Thank you, everyone, and have a lovely weekend.
Bye. Bye.
Bye-bye, sir. Have a
Thank you so much, sir. Have a lovely day. God bless you.
Bye, everybody.
Bye-bye.
Bye.
Bye.
Bye. Bye.